Good morning. Convening our Joint Health and Homelessness and Human Services Committee. Today is Friday, February 10th, 8:30 a.m. Happy Aloha Friday to all of our members, as well as members of the community present in the room and people watching on our YouTube channel. Today is a very busy day, and we're going to be jumping around with lots of joint hearings coming into this committee room. So for people watching this 8:30 a.m. agenda, I hope we are able to get through this expeditiously. And if not, we might have to recess for our 9:05 a.m. agenda. On that note, we will also be doing decision making on all of these bills on our 8:30 a.m. agenda at 11:30. So let's begin, members. First up is House Bill 897, and this is establish a task force related to fetal alcohol syndrome disorders. And yes, we have comments from the Department of Health. Thank you. We have comments from the Department of Human Services.
Good morning, Chair, members of the committee. I'm Judy Moore-Peterson, and on behalf of the Department of Human Services and Director Betts, we very much appreciate, we'll stand on our testimony, but I wanted to make sure and call out that we are requesting a couple of amendments. One is regarding the tools that, one of the sections regarding one of the screening tools, and the other is relating to making sure that we are not needing to implement without getting funding. And then the final thing is we're also requesting an appropriation in order to accomplish all the tasks. Thank you.
Thank you. We have comments from the Attorney General's office.
Good morning, Chair and members. Andrew Goff for the Attorney General. As we noted in our written testimony, the very last sentence could present a constitutional problem as it requires a future legislature to make an appropriation. So we recommend deleting it, and I'm available for any comments.
Thank you. Testimony in support, Hawaii Substance Abuse Coalition, Alan Johnson. Hawaii Fetal Alcohol Spectrum Disorders, AG, Cleota Brown. Hawaii Disability Rights Center, Lou Erdeshek. Hawaii Public Health Institute, Rick Collins. Hawaii FASD Action Group, Darlene Chen Scovelli. Hello.
Hi, good morning, Chair, Vice Chair, and all the members of the committee. I'm here in front of you once again to plead to support the FASD population. I have been working really selflessly and very hard to advocate for this invisible disability children and families. It is just so unfortunate that a child can sit there and not knowing what's wrong with them and being labeled as troubled children in the school system where they actually have neurological damage in their brain caused by alcohol. Many people have always said that, oh, they have fallen in the crack of our society, but in my opinion, they have fallen off the cliff because they have been forgotten for many, many years. This issue is actually not only nationally being started to come up and recognize and surface, but it's a global problem. I think Hawaii has an opportunity to spearhead something really tangible and important and really recognizable effort into making life possible for the children who were born in an impossible world. Thank you.
Thank you, Ms. Scoville. We have numerous individuals all in support. Sina Pili, Ann Yabusaki, Kenichi Yabusaki, Vivian Iona, Gigi Davidson, Mark Matsushita, and Thomas. Any other? Oh. Nalani Ka'ai, Linda Ilento comments. Any other testifiers in the room? Any other testifiers via Zoom? Members, any questions? Representative Kobayashi, Amato, any questions?
Nope.
No? Okay. Moving on, House Bill 900, relating to fetal alcohol spectrum disorders. Members, we have testimony in support from State Council on Developmental Disabilities.
Hi, Chair. We stand in our testimony support. Thank you.
Thank you. Comments? Department of Human Services?
We stand on our testimony. We appreciate the intent. We also defer to the budget office of budget and finance as well as the Department of Health.
Thank you. Department of Budget and Finance, comments? In support, Hawaii Substance Abuse Coalition. Hawaii Fetal Alcohol Spectrum Disorders FASD AG, Cleota Brown. In support. Lou Erdeshek, Hawaii Disabilities Rights Center in support. And again, numerous individuals, Rick Collins, Hawaii Public Health Institute in support. In support, Darlene Scovell, Hawaii FASD Action Group in support.
So, ladies and gentlemen, and people around here, these children are actually sitting with our children who is wanting to learn in the school system. And our children will not be able to learn, and the teachers will be divided. There's only two behavioral aspects in children. It's either they all turn it inside or turn it outside. That means acting out or going through a depression mode. My intention and aim in my strong advocating for this population is for them to be recognized. My battle cry has always been the right diagnosis, the right treatment, and the right services. I have been working with children with autism for many, many years. A lot of clinicians are diagnosing these children with autism only because they have services. And I do not think that we should treat somebody with hepatitis with tuberculosis medication. That's not only entirely wrong, but it's unethical and it doesn't work. And it makes the situation or the developmental problems much more complicated. So please support and pass this bill in behalf of the children with FASD. Thank you.
Thanks, Ms. Scovell. We have numerous individuals in support. Sina Pili, Ann Yabusaki, Kenichi Yabusaki, Gigi Davidson, Kendrick Farm, Mark Matsushita. Any other testifiers in the room? Any other testifiers in Zoom? Go ahead. Please identify yourself, state your name, and then go ahead and provide your testimony.
Oh, aloha, this is Linda Ilento. Apologize, I can't figure out how to turn my video on at the moment. I'm a parent and I did submit some written testimony. I wanted to see if you received it. It was late last night. And I just, in addition to the testimonies already heard, I wanted to share that, for example, the waiver program has created an ABA, Applied Behavior Analysis type of a program, but it's not really what it ABA, and I just provided some more details there in my testimony that I wanted to point your attention to, because I believe the time that's been put into creating programs and they still don't work, that you would be able to have a coordinated effort between the department and legislature as well as parents. Thank you very much for the opportunity to share testimony. Thank you.
Thank you, Ms. Alento. We've received your testimony for House Bill 897, the previous bill that's similar to this one. So if you do have additional...
Well, I apologize. It was 897.
Okay.
I thought we were still on it. That's my fault. Thank you.
Thank you very much. Any other testifiers in Zoom? Seeing none, members, any questions? I have a quick question. I don't know who to address it to, maybe budget or finance, maybe DOH. I understand the special funds in this bill would have been populated by money from the federal government. Is that bill still moving in Congress? Because I think that that might be a challenge.
Gina Moore Peterson, Department of Human Services. We're not positive of whether this bill is moving or not. And even if it was, it's until it's done and until it's passed, you do not know what the requirements or conditions will be, how it will be allocated to states, et cetera. So,
okay.
Yeah.
Thank you. Members, any other questions? Seeing none, moving on to House Bill 1308. This bill Yes, still Health and Human Services, relating to fingerprinting. Members, we have testimony in opposition from Department of Human Services.
Good morning, Chair, Vice Chairs, members of the committee. My name is Tim Hitchens, Social Services Division Assistant Administrator for DHS, and we stand on our written testimony opposing this measure. One note to our testimony that we submitted in writing. On page 2 at the very top, it says we have a joint background check system right now. While it's being developed, it's not operational just yet.
Okay.
All right, thank you for the opportunity.
Thank you. Testimony, comments from Healthcare Association of Hawaii via Zoom.
Good morning, Chair, Vice Chair, members of the committee. Thank you for allowing us to express our comments on this measure. I think similar to the previous testifier and some of the agencies, there are certain requirements that our facilities, especially the nursing facilities and hospitals, have to meet in order to do background checks, and we just want to ensure that nothing in this measure would affect the ability of our facilities to be able to carry out background checks that require the use of fingerprinting. Thank you very much.
We have testimony in support of Rosemarie Sebastian, ILW Local 1000.
Good morning, Chair, Vice Chair, and all. Yes, I'm on behalf of the ILWU Local 1000, and I stand to support this bill. I think that fingerprinting should be required to caregivers, family members, substitute, volunteer caregivers, only at the initial start of any care home business. Any disabled family individuals who are unable to walk should be excluded from this requirement. A new person or individual coming to reside at the home of a care home operator now and in the future should be required to do fingerprinting. Right now, our monthly pay for room and board does not include costs to cover fingerprinting. With all the other expenses imposed upon us, caregivers, it is very costly and not feasible for us to do fingerprinting annually or even every 3 years. I thank you for your kind support. Vote for this bill.
Thank you. In support, ILW Local 1000, Matthew Yamamoto. Testimony in support. Go ahead.
I'll start on my written testimony.
Thank you. ILW Local 1000, Jonathan Hanks. Local 1000, ILW Juanita. ILW, oh, go ahead. Thank you. ILW International, Will Chang. Okay, ILW Matthew Yamamoto. In support, Karen Idie in support. Any other testifiers in the room? Any other testifiers via Zoom? Seeing none, members, questions? Oh. Go ahead.
Chair, I apologize. Keith Ridley, Chief of the Office of Healthcare Assurance, on behalf of the Director of Health. I thought we had submitted our testimony. I'll give you my copy if we need to. Anyway, we stand in opposition to this bill. I think it's bad public policy to put a strict requirement in statute to limit fingerprinting to one time. But there is a mechanism to avoid frequent fingerprinting that's already in admin rules. Chapter 106 under the Department of Health has a mechanism for allowing for fingerprinting to be less frequent as long as the individual enrolls in RAPBAC, which is overseen by the Hawaii Criminal Justice Data Center. RAPBAC provides the ability for someone who has had a fingerprint background check to enroll, and the relevant state agency would receive a notice if that same person is arrested or convicted of a crime subsequently. But in a case where someone enrolls initially but then disenrolls or doesn't enroll in RAPBAC, we would want to have the mechanism to be able to continue to background check someone in order to make sure that the residents that they care for or live with are safe. And I'm available for any questions.
Thank you. Thank you for that testimony. Mr. Ridley, if you can provide that testimony, that would be helpful, and then you can do that after the hearing. Members, any other questions? Questions? I have a question for the AG's office, or excuse me, Human Services, that talked about the joint background check system. Is this joint background check system the same wrap back that Mr. Ridley just talked about, or is that a different program?
I think that it's different. I'm going to look over to check. It is different, as I thought, yeah.
Okay, and
Different
what's
system.
being developed is, this background check system is currently being developed. Is that what your testimony
Correct, and I
is?
understand that it's close. I don't know where it is with being available to the public yet.
Okay, and is that supposed to then help streamline for not just for all of these kinds of licensed facilities or facilities that state has oversight with?
Yes, they'd be able to use the system to do background checks. It is different from the way RAPBAC works, and that the RAPBAC is an ongoing service, as the prior testimony suggested or offered. Sorry.
And is this background check system more expansive than just fingerprinting?
I think it's inclusive of fingerprinting. Would you know this? I'm sorry.
Maybe we will bring up.
I don't know the answers to these questions. I apologize.
You stay right there, and
sure.
then if Mr. Ridley can come up.
Thank you for that question. I have been working along with an individual from the MedQuest division on this Hawaii background check system. It is a web-based portal through which an individual who is required to be background checked will apply for a background check, put in all their demographics, schedule their fingerprinting, and that mechanism will also, and we have a fingerprinting and criminal records check vendor who will do that portion of it. And then the records check also goes and looks at registries at the Department of Human Services. These are the Adult Protective Services Registry as well as the Child Abuse and Neglect Registry. There are other registries that the prospective employer could look at. These are free registries that they would look at as well to ensure that the individual who's applying for a job or someone who's applying for a license to be an adult residential care home or what have you has completed the background check. So this system is going to essentially house everything through one portal. It will also enable that background check, that completed background check, to be portable. So if I have a background check and my information is in that portal, in that system, I can elect to share that with another employer. So if I'm working at one place and I go to apply for a job part-time perhaps or on call as a care worker in another agency, I can share my successful background check results with that other employer, and I don't have to go through that process again. So that's what this system is designed to do. It is currently and has been for a couple of years in a test kind of mode with a limited number of providers. We are expecting that this system will become more widely available by early summer, this summer. And we're working with a couple of vendors to make that happen.
Okay. And so that would assist in this area?
Yes, it would.
Okay, and then I think you can go, but I want to have one more question on the wrap back. How many users do we have of this system? Do you know?
The background check system?
The wrap back.
That I don't know. That is overseen by a Criminal Justice Data Center under the Attorney General's office. I could check with them and get that information for you, but I don't know that number offhand.
Will wrap back become duplicative at the point that this joint background check system becomes live?
No.
No.
It won't be a duplicative.
Okay.
What it'll do is it'll replace the need for repeated fingerprinting and background checks of criminal records. And it only tells a relevant state agency, for example, if we're licensing an applicant for an arch license, for example, and there is someone, an adult living in the home, not a caregiver, who has a background check, it essentially keeps record of that background check, and if that person were to be arrested or convicted of a crime, we would get notified.
Okay.
So we could potentially take some action.
Okay. Is there a charge?
I'd like to I was just going to answer that. I anticipated that there's no charge to enroll in RAPBAC.
Okay. Okay. Thank you.
You're welcome.
Thank you. Members, any other questions? Seeing none, moving to House Bill 1309 relating to care homes. We have comments from the Department of Human Services.
Good morning, Chair, members of the committee. Judy Moore-Peterson on behalf of the Department of Human Services. The comments, they're quite extensive that we submitted. And so I just wanted to let the committee know that we're available to answer them. But in short, if the committee adopts our recommendations for the amendments and the restatement of the purpose, then an appropriation would likely not be needed. And the other thing I just wanted to note is that these are not Medicaid payments. There's a lot of times people think that it's related to Medicaid, and it's actually not. So the relevant statute that we're requesting or recommending be amended is 346-53C, in which those payments, the state supplemental payments, are written, the amounts are written into the HRS. Thank you.
Thank you. Testimony and support, members. We have numerous testimonies in support from individuals, care homes, ILW Local 1000. I'd like to ask if anyone here in the room would like to testify. They can come forward. And most of this is all in support. If you want to come forward and identify yourself.
Madam Chair Belati and committee, good morning. I'm Delia Cabingabang, care home operator for 44 years. I'm representing ILW Local 1000, and I'm a licensed care home administrator. I strongly support HB 1309. My care home residents have had chromosomal deficiencies, blind, and schizophrenia. They have been with me for the past 44 years. I admitted them when they were still teenagers. They were very young. 2 of them were abandoned, and some have their own family but cannot take care of them because they had to work for their growing family. Ever since they came to my care home, I have served them like a mother. I cook for them, I feed them, I do laundry, and everything, just like we are jack of all trades. It is a big responsibility to work as a caregiver. I also want to retire soon. I'm looking for someone who had the right attitude to take over my facility or my patients. This job does not attract younger generations due to the long hours the job requires. The pay is not enticing, $50.50 per day, $1,515.90 per month. This is a challenge for all of us. The future of the care home industry is diminishing, considering the high numbers of the elderly population, plus the incoming baby boomers, as well as the existing clients in our facilities. I'm talking mostly about the Medicaid clients, if you folks have to reconsider that. Thank you.
Thank you so much. Any other testifiers in the room who would like to testify in support? Please come forward, don't be shy. And you can start to line up in behind. So we only have 2 more testifiers in the room. Okay, go ahead.
Hi, good morning. I'm Libby Vargas. I'm 80 years old, and I'm with the ILWU 100 trustee and a licensed care home for 40 years. My care home residents have been with me for the past 39 years. I admitted them when they were very young and when their family could not able to take care of them, their own home, because they also had to work for their own growing family. Ever since they come to my care home, I was what they called mom, what work and them like a mother cook, and feed them 3 times a day. Their medication ordered by their physician assist them in their activities for daily living, housekeeping, and all day morning. It is hard it is hard work every single day. No day off, and challenge for the trustees, substitute caregiver. All clients are medicated recipient and get paid $50.50 per day. That is $1,515.90 per month a client. You all may say to me that it is time to retire. Yes, I want, but I look back for my 40 years in the business. I would like to somehow experience and know the feeling of received to perish after 14 years. I want also to prove to the younger generation that the lawmakers of the state did not forsake me and caregivers. And that is the legacy I want to leave behind. Thank you.
Thank you so much. And next.
Good morning again. I'm Rose Sebastian. I'm with ILWU, Local 1000, and I'm also one of the healthcare contractors for the state of Hawaii. We care for the impoverished and the Medicaid benefit recipients who are unable to care for themselves. We provide for their housing, meals and snacks, daily needs, 24/7, 365 days, supervision, and in some cases, medical care, provide transportation to doctors, and also provide medicine monitoring. Our care home is a Type 1 ARCH. We get paid through SSI, MedQuest, for room and board. Just like what you heard earlier, we get paid $15.90 per month per patient, effective January 2023. And although there are some levels of burden of care, we don't even get paid for burden of care costs. Just like any other business, we also have so many expenses, such as DOH annual fees, GE taxes, mortgage, utilities, professional liability insurance, automobile, car insurance, gas, continuing education, substitute fees, business license renewal, fire inspection, office and cleaning supplies, house cleanings, professional dues, laundry and paper supplies. You know, for your information, there are some patients who are actually using toilet every 15 minutes. They can't help it. It's a medical condition. So can you imagine how much utilities, water, paper we're expending per month? And worst of all, inflation in costs to provide care for and feed our clients has skyrocketed that our pay is not enough. So I, along with other caregivers, humbly ask you to consider giving us a fair and respectable raise. Our bill is asking for $700 increase per patient in addition to what we are already getting today. Caregiving is not an easy job. It is hard, especially when the patient has complex medical conditions and or having behavior issues. There are so many hardships involved in caring for all types of patients. It would take me all day to talk about it. We were told before that we chose to do this job. Therefore, we should accept whatever pay there is. I think this is so disrespectful to all caregivers who are caring for the most vulnerable individuals. Caregiving goes beyond a regular job. And as a caregiver myself, I am so proud to be able to work a job that makes a difference in people's lives. Without caregivers, our patients don't have anyone to love and care for them, and you can't put a price tag on that. In Hawaii, there's a big hype about caring for the kupuna, elderly, disabled, the homeless. And it makes me so proud to be a part of the Hawaiian community because I thought we have so much aloha. There are so many advocating for our patients, as it should be. But how compassionate can we be as a community or as a society if we can't be fair to caregivers who are tirelessly working, hard caring for these people? No one is advocating for caregivers' best interest. We have to come here to ask for minimal raise, which we so deserve. We are caregivers. We should be spending time with our patients. It is so difficult for us to have a little raise. We haven't got a raise for the last 14 years. Can anybody tell me a corporation or any company who don't give raise to their employees? You know, it's so unfair. I think that's why I was convinced to join ILWU, because we need help. We need someone to advocate for us. So again, I ask you for your kind support. Vote. Give us what's fair, what's proper, because it is the right thing to do. Thank you.
Thank you. We're going to pause. We have our 9:05 agenda that's going to start. I acknowledge that there's one more testifier. Is there any other testifiers in the room for House Bill 1309? So we will resume this hearing at 9:30 a.m. in this room. If you are not able to stay, you can leave your testimony and we will accept it. And we will resume this hearing at 9:30 a.m. Members, we are in recess.
Good morning, everybody. Welcome to our joint hearing of the Economic Development and the Health and Homelessness Committee. Today is Friday, February 10th, 9:05 hearing in conference room 329. We have one measure on our hearing today. It's House Bill 66, oh wait, no, that's the wrong one. Too many agendas. House Bill 1050, relating to the general excise tax exemptions, exempt certain groceries, feminine hygiene products, incontinence products, and over-the-counter drugs from the general excise tax. Oh, sorry, I'm jumping the gun a little bit. In order to allow as many people to testify as possible, there will be a 2-minute time limit per testifier. Please know that committee members have received your testimony, so if you'd like to stand on your written testimony, that'd be appreciated. We're continuing our hybrid system with Zoom and live testifiers this year, and I'd like to ask members on Zoom to please keep yourself muted and your video off while waiting to testify and after your testimony is complete. Please avoid using any profanity and from using any trademarked or copyrighted images in your background. Okay, back to the agenda. So HB 1050, our first testifier is Office of the Governor in support.
Morning, chairs, vice chairs, members of the committee. Blake Oshiro, senior advisor to the governor. We thank you for hearing this administration bill. We'll stand on our written testimony and strong support, and I'll be available for any questions. Thank you.
Thank you very much. Next, we have Department of Taxation.
Good morning, Chair, Vice Chair, members. My name is Brian Davidson. I'm here on behalf of the Department of Taxation. We stand on our written testimony, and I'm here for any questions you may have.
Thank you very much. Next, we have State Council on Developmental Disabilities in support. Thank you very much. Next, we have Tax Foundation of Hawaii with comments. On Zoom.
Good morning, chairs, vice chairs, members of the committees. Tom Yamachika from Tax Foundation of Hawaii. We've submitted written testimony. We'll stand on that and be available for questions.
Thank you very much. Next, we have the Hawaii Food Industry Association in support.
Thank you, Chair. Lauren Zorbel on behalf of Hawaii Food Industry Association. We're in strong support of this measure. This is actually our #1 priority issue this year, issues relating to food security and the affordability of food. This bill would really help low to middle income families. They spend a disproportionate % of their income on food. Hawaii is one of the most expensive states for food prices, and also has the second highest tax burden of any state. It's only a slightly below New York. So we think that this is a great way to kind of bring Hawaii in line with the rest of the United States. We're one of only 6 states that taxes groceries fully. So we strongly support this. Thank you so much for the opportunity to testify.
Thank you. Next, we have Grassroots Institute of Hawaii with comments.
Aloha, Chair, Vice Chairs, members of the committees. My name is Ted Kafalis with Grassroots Institute. I'll try to keep this brief, but just wanted to point out that while SNAP recipients are not charged with GET, we can't forget about those that might not qualify for food stamps and are still struggling to make ends meet here in Hawaii. We also appreciate that this bill limits the exemption to SNAP-eligible food and keeps the GET on restaurants, so it kind of alleviates some of the concerns that tourists would be paying for this. It would be saving the tourist money. So, we appreciate you all taking this bill under consideration today and stand by with any questions. Thank you.
Thank you very much. Next, we have Brian Miyamoto, Hawaii Farm Bureau in support.
Good morning, Chair. The Hawaii Farm Bureau will stand on its written testimony in support.
Thank you very much. And next, we have Kendo Matsuyoshi, Local Food Coalition in support.
The Local Food Coalition will stand on its testimony in support.
Thank you very much. And we have Ilima Di Costa, Hawaii Health and Harm Reduction Center in support on Zoom.
Aloha, chairs, vice chairs, and members of the committee. Hawaii Health and Harm Reduction Center stands in support of HB 1050. Mahalo.
Thank you very much. We have numerous members signed up, but not signed up to testify in person or on Zoom. Is there anybody else wishing to testify on this measure? Seeing none, members, do we have any questions? Representative Pong.
You're supposed to go first. Thank you, Chair. We'll call up the Local Food Coalition. Kendall, please, real quick.
Good morning, Representative.
Good morning, Kendall. Thank you. Can you explain to me real quickly the difference between a GE tax and a sales tax, succinctly?
GE tax is the tax you pay on the ability to do business in Hawaii. That's what I understand.
And the sales tax?
A sales tax is a tax on goods. From my understanding, I'm not a tax person, so.
Okay.
Yeah.
Are we able to control pricing?
As
Be
far as
it
the
you
state
or the government? Are we able to control pricing?
No, I don't think so.
So sorry, interrupted. So the cost to the consumer, is there possibly no savings at all, even if we pass this bill?
For SNAP eligible groceries, they would save on the tax, the GET.
So what is a SNAP eligible grocery?
I don't know. I would have to defer to the Hawaii Food Industry Association.
Okay,
I'm not too sure what SNAP eligible groceries are.
So because of the difference in systems, is there could there not be any benefit to the consumer?
Again, I think the benefit to the consumer is they would save on the tax, which they could then spend on to other things.
But according to you, the GE tax is paid by whom?
Both businesses and the customer. It's passed through to the customer, which then the business pays to the state.
Right. So does a business have to show a pass-through to the consumer?
I'm not a tax expert, so sorry, I can't answer that question.
Okay, thank you, Chair.
Thank you.
Thank you, Kendall.
Any further questions, members?
Question.
Representative Kobayashi.
This is a comment perhaps to Attorney General to look at the definition of over-the-counter medicines. I'm not sure that that's an exact or understandable term, given that the average person may include many things as over-the-counter medicines, which are not exactly medicines, including a whole array of, shall we say, cough and cold medications.
Thank you, Representative. Any further questions?
I'll leave it.
Okay, thank you. We're going to recess this hearing for decision making, which may be after our 9:10 agenda. Recess.
Okay. Opening up our 9:10 a.m. agenda, Health and Homelessness Committee along with a Committee on Economic Development to take up House Bill 662. This is a more slimmed down version of a GE tax exemption, focusing on bringing parity between Medicaid, Medicare, and TRICARE payments for individual providers in the community. Members, first up, we have testimony, comments, Department of Taxation.
Chair, Vice Chair, members of the committee. Again, my name is Brian Davidson. I'm here on behalf of the Department of Taxation, and we stand on our comments, and if you have any questions, I'm happy to answer.
Thank you. Members, testimony and support from University of Hawaii, Dr. Lee Buenkunseo Lum. Testimony and support from Jean Miskovich, Office of the Mayor, County of Hawaii. Testimony and support, Alan Johnson, Hawaii Substance Abuse Coalition. Testimony and support, Hawaii Island Chamber of Commerce, Keith Marek. Testimony and support, Hawaii Association of Professional Nurses, Brad Kuo, via Zoom. Mr. Kuo, are you present? If not, okay, moving on to Alima DeCosta, Hawaii Health and Harm Reduction Center in support via Zoom.
Yes, aloha chairs, vice chairs, and members of the committee. The Hawaii Health and Harm Reduction Center stands in strong support of HB 662. Mahalo.
Thank you. Hawaii Independent Physicians Association in support. Martha Randolph, the Kapuna Caucus of the Democratic Party of Hawaii in support. Hawaii Radiologic Society in support. Kauai Community Health Alliance in support. APTA Hawaii in support. East Hawaii IPA in support. Hawaii Dental Service in support. Dr. Frederick Nitsa in support. Joyful Living in support. Synergy Health in support. San Miguel Endocrine Inc. in support. Hawaii Medical Association in support.
Good morning, chairs, vice chairs, and members of the committees. My name is Dr. Beth England. I'm representing the Hawaii Medical Association. We stand in strong support and are available for any questions. Thank you.
Okay, we have testimony in support from Dr. Smith, Family Medicine. In person, we have in support AARP Hawaii.
Good morning, chairs and members of the committee. I'm Audrey Suga Nakagawa, Advocacy Director for AARP. AARP is in support of the intent of this bill, and our reason is because of the diminishing access to health care. We're very concerned with the shortage of healthcare providers, many doctors who are retiring. There's younger doctors who are leaving the islands and not opening up their businesses here, their practices here. We're very concerned about our Medicare population who will not be able to access their physicians. There are 279,000 Medicare beneficiaries in the state of Hawaii, and we know that number is growing. So if they don't have access to physicians who are willing to take their coverage, as well as to the other vulnerable populations like the Medicaid and TRICARE, they are going to be in dire straits. We know the problem is really big in Hawaii. In Oahu, you know, there are problems finding doctors who are taking them, but you can imagine the problem being even greater on the neighbor islands. I attended a conference last year in which there was a provider, a group practice in Kauai, who talked about closing the ship. I'm sorry, I have something in my mouth. And you know, they were on the brink of closing their practice, and they were like the only healthcare providers in that particular area of the community. And so this is not the total panacea to their problem, but it is one step in trying to retain, attract, and compensate our physicians so that they could provide care to our populations. Thank you.
Thank you. We have comments from Tax Foundation of Hawaii.
Thank you, chairs, members of the committees. Tom Yamachika from Tax Foundation of Hawaii. We have a problem here because medical services rendered at a nonprofit hospital, infirmary, or sanitarium are exempt from GET, but the same services rendered by individual or group practices or clinics are fully taxable. And this problem is kind of made, you know, more harsh to the medical providers when you have Medicare, Medicaid, or TRICARE being the payor, because there are actually regulations that prohibit the passing on of any GET, like any other administrative cost, to patients. So in a private pay situation, some doctors or dentists can pass on the GET to patients offline. But within the governmental health programs, they can't do that. They can get written up for Medicaid fraud or, you know, similar disciplinary action. This has been blamed for, or, you know, at least in part for our healthcare shortage. You know, that we have a very severe physician shortage. And if you look at the experience of Hawaii Medical Association, you know, the hospital that tried to get itself established in EBA a few years ago, you know, they went down in flames, and the GET was cited as one of the problems. because they were for-profit and the hospital exemption didn't apply to them. Thank you very much for your time. I will be happy to answer any questions.
Thank you, Mr. Yamachika. Grassroots Institute of Hawaii, comments in person?
Aloha, chairs, vice chairs, members of the committee. Ted Kafalis with Grassroots Institute. Not to double up on Tom's testimony, but I just wanted to point out that Hawaii is one of only 2 states that currently taxes medical services, and we're the only state that taxes Medicare and TRICARE services. So we do feel that this is a good bill that would bring Hawaii into the mainstream. You guys all should have received our policy report that kind of goes into the details of how this the GET cannot legally be passed on to recipients of TRICARE or Medicare. So we appreciate you guys considering this bill today again, and thank you for the opportunity to testify.
Thank you. We have numerous individuals who provided testimony in support. Is there anyone here in the room who would like to testify? Seeing none. Anyone in Zoom who would like to testify? Please identify yourself. Turn on your
Good
video.
morning, chairs. Hi, my name is Dr. Christian Kitamura. I actually represent Synergy Health LLC, so I got passed over. But again, chairs, vice chairs, and members of the committee, thank you so much for this opportunity. I am the privilege of being a board-certified internal medicine physician here in Hawaii, and I was a local girl born and raised here in Mililani, and I'm happy that I get the opportunity to serve my patients in the community. As a doctor who actually had the privilege of working for our larger nonprofit organizations, but now currently on my own private practice, I work in partnership with Aloha Gastroenterology to serve our growing population for screening, treating, and preventing colon cancer, which is the 3rd leading cause of death here in the United States. I also have the privilege of working as a faculty member at the John A. Burns School of Medicine here in Hawaii as a learning community mentor, and I get to work closely every week with 1st, 2nd, 3rd, and 4th year medical students to help grow our very much needed working force here in Hawaii to keep our local talent here, given the ongoing physician shortage. So one of the things I do teach my students about different aspects of healthcare, and it is true that the GE tax issue that gets passed on to patients and the discrepancy between our Medicare, Medicaid, and TRICARE patients do pose a difficult financial problem for our private practice physicians such as myself. The problem with retiring physicians leaving Hawaii is that the access to care makes it the discrepancy for our patients. So physicians have to make the decision to sometimes not take Medicare patients and Medicaid patients. However, it has a burden on other practices trying to absorb that need because we know the need to screen, prevent, and treat cancers. It does pose a discrepancy. We want to alleviate that imbalance because all patients deserve access to care. All patients deserve access to quality, effective, efficient care. And with this discrepancy in the GE tax, as other people have stated here, us being the only state who still taxes that, it puts our Hawaii population at extreme detriment. So again, I thank you for this opportunity to speak on this issue, and I'm hoping to aid in whatever I can to help keep our workforce here in Hawaii for our future physicians. Thank you.
Thank you, Doctor. Any other testifiers in Zoom?
This is Dr. Thomas Francis.
Okay, I'd like to, we're hitting up on some time deadline, so I'd like you to please, if you've submitted testimony, stand on your testimony and only highlight what are the important points you'd like for the committee members to hear. Go ahead, Dr. Francis.
Hi, I'm a retired physician effective December 2021. Dr. Powell asked me to testify for this. I had 11 years of experience going over to Hilo as an endocrinologist, and I saw the primary care and issues over there and have seen the issues here. And having run a small private practice, I basically had to close because of financial issues. I initially did not take Medicare, did not take Medicaid because I'd heard so many bad things about it back in 2011, and those were all basically borne out. And I've taken care of TriWest and TRICARE VA patients, and also stopped taking care of them because there was such a burden to it and we couldn't get paid for our services. So in the end, the practice closed for a number of reasons. And the excise tax is but a small part of it. But this is a small step in basically supporting the physicians that are still in the force and to stay in the force if you'd support it. It's been a year since I submitted my last testimony and it went nowhere. I'm really hoping that this year you'll think about it hard, look at all those detailed comments from all your supporters. They all say the same thing: you need to pass this. And I just want to emphasize again that if you want us to take Medicaid, Medicare patients, or TRICARE patients, you have to basically support the physicians. Goodwill has run out, and you need to basically understand that. Thank you very much.
Thank you. And the last testifier in Zoom. Is there another testifier? Go ahead.
Hi, this is Dr. Cindy Powell, endocrinology, and I wanted to share a video that was made by my colleague, Dr. Kyle Chun. So I'm going to share his video. It's pre-recorded.
Good morning. My name is Kyle Chun. I'm an orthopedic surgeon recording this in Prescott, Arizona on February 9th. I'm recording this in support of House Bill 662. I was born and raised in Waihoa, went to public school and graduated from medical school at the University of Hawaii. I did my residency at the University of Washington and a sports medicine fellowship in Los Angeles. I returned home in 2014 to join Orthopedic Associates as a private practice orthopedic surgeon and practiced for 8 years before leaving in 2022 with my family back to Arizona to start all over again. I left due to the increased difficulty of running a private practice and the increased costs that prevented me from adequately taking care of my patients the way I felt they needed to be taken care of. I strongly urge you to support this bill in order to prevent the continued hemorrhage of locally grown physicians and specialists in our state. Thank you.
Thank you. Thank you. Any other testifiers? Seeing none either in Zoom or in the room. Members, any questions? Members, okay, we are going to, seeing no questions, ECD needs to get into another hearing at the moment, so we're going to defer decision making on these measures until 10:15. Correct? For both the 9:05 and the 9:10 agenda. We're going to defer decision making until 10:15. Thank you. We are in recess. Reconvening our 8:30 a.m. agenda for Health and Homelessness and Human Services Committee. We had one testifier who was going to testify in support of House Bill 1488. Is that person still here? If not,
Wait.
okay, thank you. The statement was provided to the committee clerk. It will be provided to the committee. Any other testifiers in the room on House Bill 1488, excuse me, 1309, sorry, it was 1309, 1309.
I am your.
Go ahead.
Good morning, Chair Belate, Vice Chair, and members of the committee. I am Juanita Ulev, Type 1 arts caregiver for 38 years. And I'm fully in support with 1309 for the following reasons. For 14 years, we never had an increase. Within the 14 years, cost of living has rocketed. Type 1 arts also take care of spatial diet. Type 1 arts also take care of incontinent patient. Type 1 arts caregiver also take care of dialysis patient. And for one individual, for the 1,500 that we are receiving, I have a breakdown that I can give you. Room nowadays is 700. Food cost is 550. This is the average cost of living. Utility for them is $100. We paid excise tax for that for $68 a month. We paid for our insurance. We are also paying for our licensing fee. On top of that, we are paying also for our fingerprint. What about our toiletries? We can just consider $50 a month. And some other miscellaneous expenses, $100 a month. What is left for us is zero. So it's only feeding for us for now. The 700 that we are asking is just minimal for the 14 years that we've been asking. We've been neglected for 14 years. Please help us support this bill to compensate us fairly. Thank you very much for this opportunity.
Thank you. Any other testifiers? Members, any questions? All right, moving on, members, to our next bill, House Bill 1488. This is relating to respite care. We have testimony in opposition from Department of Health.
Good morning, Chair, members of the committee. Keith Ridley, Chief of the Office of Healthcare Assurance, on behalf of the Director of Health. We'll stand on a written testimony in opposition and ask that this bill be deferred, and we're available for any questions. Thank you.
Thank you. Testimony in opposition for the Department of Human Services.
Good morning. On behalf of the Department of Human Services, we stand on a written testimony in opposition.
Thank you. Testimony with comments from the Attorney General's Office.
Good morning, Chair Bellotti, members of the committee. My name is Angela Takuda, Deputy Attorney General. We submitted written comments for this bill regarding the appropriations section that it may violate the Hawaii Constitution as the payments appear to be grants of public funds without standards provided by law. I'll be available to answer any questions. Thank you.
Thank you. Testimony in support from Eola Care Home, Inc., Sheila Mari Pusi. Testimony in support, Jonathan Hanks, ILW Local 1000. Testimony in support, Will Chang, ILW International. Testimony in support, ILW Matthew Yamamoto. Testimony in support, Maria Corazon, E. Cariaga. Testimony in support, Karen Irie. Testimony in support, Kaili Swan. Present via Zoom.
Sorry, I'm here. My name is Kaili Swan. I'm in strong support of the House Bill 1488. Caregiver deserve a paid vacation leave. They work 24-hour tirelessly to make people with disabilities stay safe. Vacation help people feel better. They hope better, so they'll be happier when they come home from work. Stay strong, and please let me know if you have any questions. Don't be shy.
Thank you, Mr. Swan. Any other testifiers here any in the room? Our DD division?
Aloha, Chair. My name is Chase Silver. I'm with the Hawaii State Council on Developmental Disabilities. I know we're tight on time, so we just as a clerical error, we missed this bill, so I'll just give our testimony to the clerk, if that's okay, and we're in support.
Thank you.
Thank you.
Any other testifiers in the room?
Thank you, Chair, and everyone. I stand to support this bill, number 1488. While our room and board pay does not include some allowance for vacation pay, caregivers also need at least some time off from caregiving. Therefore, we ask that DOH provide respite care for our patients. And just like everyone else in the work industry, we deserve, and it's important for us caregivers, to have some time off to recoup from the burden of caring 24/7, 365 days a year. It's good for our well-being. Can you imagine we don't even have any vacation at all? Who is a corporation or work industry employer who don't give vacation pay to their employees? I'm sorry. Thank you.
Thank you. Any other testifiers in support? Please come forward, identify yourself and who the written testimony is from, and then submit it to the committee.
Hi, my name is Matthew Yamamoto with the ILWU. Thank you, Chair, Vice Chair, committee members. Just here to support the bill, and our president, Susan Kinabo, had to leave, but she left her written testimony for me in my hands, so
Okay.
I'm going to turn it in.
Wonderful.
In support of the bill. Thank you.
Thank you. Any other testimony? Any other testimony via Zoom? Members, any questions? Seeing none, members, moving to House Bill 1491. This is again related to care facilities and inspections. Members, we have comments or testimony in opposition from the Department of Health. Comments from the Department of Human Services.
Good morning, Chair. Keith Ridley, Chief of the Office of Healthcare Assurance. On behalf of the Director of Health, we stand on our written testimony in opposition of this bill and ask that it be deferred, and I'm available for any questions.
Thank you. Comments from Department of Human Services.
Good morning, Tim Hitchens, Assistant Administrator, Social Services Division for Department of Human Services. We stand on our written testimony offering comments and deferring to the Department of Health. Thank you.
Thank you. Testimony in support, ILWU Local 1000, Rosemarie Sebastian.
Which bill? I'm sorry.
This is House Bill 1491, related to inspections.
Can she read my testimony?
Sure.
Thank you.
Good morning.
Good morning, Chair Yana Belati and Vice Chair Jenna Takeuchi, members of the committee. I am Esther Pascual. I've been a care home operator for over 50 years, and I am also the second Vice President of the ILWU 1000 Hawaii. I also work with the Office of Elections, and I was an election official on that every election for 13 consecutive elections. I am in strong support of House Bill 1491 with the amendment to include unannounced relicensing or recertification of adult residential care home and foster homes. I stand to support House Bill 41. Safety of our clients is always a top priority for our care home, and I'm sure that my fellow caregivers do as well. However, just like any other industry, there'll always be a few bad apples but all other caregivers should not be identified or defined by other people's wrongdoings because it's unfair. So we understand that there are complaints reported that are true, but there are also complaints that are not true. In our industry, there are always actually envious and devious, mean-spirited people around us that are quite capable of causing damages to care home operators. So when the Office of Healthcare Assurance should receive such complaints against a care home, the Department of Health should do their due diligence to their fact findings first. It is important and fair to know who the complaint's identity, and to ensure credibility of the complaint before the Department of Health through Office of Healthcare Assurance takes an aggressive action against any care home. Also, when it comes to inspections of annual licensing, Department of Health through Office of Healthcare Assurance should give caregivers a specific date and time to visit our homes and or give us a specific week of the month to do their inspection. Why this is more sensitive and productive for our concerns? Because right now, caregivers have to block the entire month, pushing back our important doctor's appointments or patient appointments for our patients. To benefit everyone, I am sure there's a better, more efficient way to annual inspection from how it's being done today. So please consider the passing of this bill. Thank you very much.
Thank you. Testimony in support, ILW Local 1000, Matthew Yamamoto. Thank you. Big Island Adult Foster Home Operations, Maria Corazon E. Cariaga in support. Testimony in opposition, State Long-Term Care Ombudsman Program. Testimony in support, ILW Local 1000, Jonathan Hanks. Testimony in support from Local 1000, ILW Juanita. Testimony in support, Will Chang, ILW International. Testimony in support, Victor Ramos, individual, and testimony in support, Karen EDA. We also have testimony from Tani Kagesa. In opposition, Dale Head in opposition, Dawn Smith in opposition, Linda Wakataki in opposition. Any other testifiers in the room? Any other testifiers via Zoom? Seeing none, members' questions.
I have my hand up. Sorry, it just took a moment. This is Greg Masakian.
Okay, go
via
ahead,
Zoom.
Mr. Masakian. Go ahead, Mr. Masakian.
Thank you. Just getting my testimony up here. Aloha committee members, mahalo for the opportunity to provide testimony. My name is Greg Masakian. I'm the second vice president of the Kakua Council, an organization that advocates for our kapuna. I strongly oppose HB 1491. I am in agreement with the testimony of John G. McDermott, the state long-term care ombudsman, who also opposes HB 1491. I do not understand how this bill ever made it to a committee hearing, and it's clear from written testimony I read last night that it is being supported by those operating or working in care homes.
Okay, excuse me, I think it's not appropriate to be commenting on the testimony of others and to infer any kind of intent, so please limit your comments to the merit of the bills, please. Thank you.
With limited time, and I'm almost done, with limited time I will emphasize just one example of why this bill should not pass. 27 veterans and their spouses died at the Yukio Okutsu State Veterans Home due to numerous deficiencies discovered during post-death inspections by the Department of Health. There are real-world and tragic consequences when licensed care facilities fail to comply with rules and regulations. The decision you make should focus only on what is best for our kapuna and nothing else. I ask you to please read what you introduce, and well, this is actually to House Speaker Saiki and all legislators. I ask you that you please read what you introduce and only introduce bills that are clearly intended to help and protect our kapuna and all residents of Hawaii. Thank you.
Thank you, Mr. Masakian.
Sakian.
Thank you. Any other testifiers in Zoom? Members, any comments or questions? Can I have a question of Department of Health? Is it a standard best practice across the nation for the regulation of these kinds of homes to have unannounced inspections?
Yes, it is. including federal inspections.
Okay, thank you. Thank you. Members, any other comments or questions, or not comments, questions for any of our testifiers? All right, I believe that is the end of our 8:30 a.m. agenda. We will recess for decision-making on all of these bills to 11:30, to our 11:30 a.m. agenda. Members, we are in recess. Good morning. Convening our 10 a.m. agenda for the Committee on Health and Homelessness. Today is Friday, February 10th, 2023. Happy Aloha Friday to all who are present. First up, members, this is our very broad, comprehensive agenda relating to cesspools 180, House Bill 180, House Draft 1. First up, we have testimony and support from the Department of Health. Testimony and support from the Department, go ahead, Department of Health. As we're gathering in, let me just explain what's going to happen. We are going to be going into recess at approximately 10:15 as we're going to have another committee come in to do some decision making, and then we will resume this. All right? Go ahead, Department of Health, House Bill 180, House Draft 1.
Good morning. My name is Mark Tomomitsu of the Department of Health Wastewater Branch. I'm here for Sina Pruder. The Department of Health stands on our written testimony and support. Thank you.
Thank you. Testimony and support, Department of Land and Natural Resources. Testimony and support, State of Hawaii Climate Change Mitigation and Adaptation Commission. University of Hawaii, testimony and support. Hawaii County Department of Environmental Management in support. Testimony and support, Hawaii Realtors. Let me go back. Is the University of Hawaii Melanie Lander here via Zoom?
I am.
Go ahead.
Good morning. The UHC Grant College Program and Hawaii Water Resources Research Center stands on its testimony in strong support.
Thank you. Rotary Club, Hanalei Bay in support. Mark Wolfendale. Testimony in support, Hawaii Reef and Ocean Coalition, Ted Bolin. Testimony in support, Ulupono Initiative, Micah Munikata. Testimony in support via Zoom, Wastewater Alternatives and Innovation, Stuart Coleman.
Hi, Chair, Vice Chair, and committee members. My name is Stuart Coleman, and I'm the co-founder of VI, Wastewater Alternatives and Innovations, and we stand on our testimony in strong support. And just want to add that this was one of the top recommendations of the cesspool conversion working group, which we just finished, we wrapped up not too long ago.
Thank you. Thank you, Mr. Coleman. Mark Hickson, individual in support. Daniela Escontrella, individual in support. Cynthia Punihauli Kennedy in support. John Potts in support. Marjorie Irway in support. Members of the audience, any other testifiers in support or opposition? Any other testifiers in Zoom? Come forward and identify yourself. And for Zoom, anyone in Zoom? Okay, go ahead, sir.
Hi, my name is Jadu Yeagle. I'm a psychologist to testify in support.
On House Bill 180 related to cesspools.
Sorry.
Okay, no worries.
First timer.
No worries, no worries, no worries. Any other testifiers in support for our HB 180 cesspools? Seeing none, members, any questions? Seeing none, moving on to House Bill 440. Again, this is the second bill on cesspools. Department of Health in support.
Good morning. This is Mark Tomomitsu of the Department of Health Wastewater Branch. We stand in support of our written testimony. Thank you.
Thank you. Department of Taxation, Gary Suganuma, comments?
Aloha Chair, Vice Chair, members of the committee. My name is Charlene Tagami and I'm here on behalf of the Department of Taxation. The department stands on its written testimony. I'm available for any questions. Thank you.
Thank you. University of Hawaii in support, Melanie Lander via Zoom.
Aloha. Yes, the University of Hawaii Sea Grant College Program and Water Resources Research Center stand on our written testimony in support. Thank you.
Thank you. Testimony in support, State of Hawaii Climate Change Mitigation and Adaptation Commission. Testimony in support, Hawaii County Department of Environmental Management. Comments from Mr. Tom Yamachika, Zoom. Okay, Rotary Club Hanalei Bay, Mark Wolfendale in support. Ted Bolin in support. from Hawaii Reef and Ocean Coalition, Maika Munikata, Ulupono Initiative in support. In support, why? Mr. Stuart Coleman via Zoom.
Hi, committee members. I'll stand in our written testimony in strong support and just mention one thing about the disclosure, the real estate disclosure. I think it's a good idea just because we were reached out to by some homeowners on the Big Island who bought a property and they weren't aware of the cesspool issue. And so they had spent all their money, and when they realized they couldn't do any renovations, it just created a lot of confusion and anger and near litigation. So I think it'll be just something that we can clarify for homeowners, buyers, and sellers, just to make sure they understand what's at stake. Mahalo.
Thank you, Mr. Coleman. Hawaii Realtors, comments.
Good morning, Chair, Vice Chair, and members. Hawaii Realtors stands on our testimony providing support for the tax credit portion of this bill. We also have suggested amendments for the disclosure portion of the bill. These are friendly amendments that we've already talked to the introducer about. Specifically, the section that the disclosure portion is in right now is not the appropriate section. That is for the section of disclosing documentation, such as condo bylaws. The section we're proposing to move it into actually has to deal with disclosure of information and requirements there too. So we've rewritten the language which specifies that the residential real property contains a cesspool, and the cesspool is identified as by the maps in the University of Hawaii 2022 Hawaii Cesspool Hazard Assessment and Prioritization Tool. The seller shall include as a material fact information on the disclosure statement provided to the buyer subject to this chapter. The map shall identify the cesspool priority level and the date established by law by which the cesspool is required to be upgraded or converted to a Director of Health approved wastewater or connected to a sewage system. We also, my apologies, neglected to mention that if there are changes to the standard forms that we generate for the industry, the next batch of standard forms would come out in November, so we respectfully request that the implementation date be delayed until November to go along with the next batch of forms. Thank you.
Okay, testimony in support, Mark Hickson. Testimony in support, Daniela S. Contrella. Testimony in support, Cynthia Puni-Haule Kennedy. Testimony in support, Will Carone. Audience members, any other testifiers here in the room? Any other testifiers in Zoom? Seeing none, members, any questions? Seeing none, moving on to House Bill 1396, third one. Okay, House Bill 1396, in support, Department of Health.
Good morning. My name is Mark Tomomitsu of the Department of Health Wastewater Branch, and we stand on our written testimony in support. Thank you.
Thank you. Melanie Lander in support via Zoom.
Aloha, the UHD Grant College Program and Water Resources Research Center stand on our written testimony in support. Thank you.
Thank you. State of Hawaii Climate Change Mitigation and Adaptation Commission in support. Leah Laramie. Michael Dahili, County of Kauai Managing Director in support. Ramsey Mansour, Hawaii County Department of Environmental Management in support. Ms. Garcia, Hawaii Realtors in support.
Good morning again. Lindsay Garcia for the Hawaii Association of Realtors. We are in very strong support of this bill. We believe it would be extremely beneficial to have the Department of Health work with the counties to tackle a pilot infrastructure project on an identified priority area and collaborate with stakeholders and homeowners and provide much needed funding to convert cesspools. So thank you for this measure.
Thank you. Testimony and support from Y, Stuart Coleman, via Zoom.
Hi. Yes, thank you so much. We stand in strong support of this bill, and we'll stand on a written testimony. If there are any questions, please let us know.
Thank you. Testimony and support, Mark Wolfendale, Rotary Club Hanalei Bay, Hawaii Reef and Ocean Coalition, Ted Bolin in support, Ulupono Initiative in support, Maika Munikata. Testimony and support from individuals, Mark Hickson, Daniela S. Contrella, Cynthia Puni-Haule Kennedy. Any other members of the audience here to testify? Any other members in Zoom here to testify? Seeing none, members, any questions? Seeing none, for the testifiers who are here on these three bills, Chair's inclination is to move this to decision-making 11:30 a.m. on Wednesday, so you do not need to stay here if you have other hearings to go to. And we will resume decision-making on all three of the measures next week. Members, moving on to House Bill 378 relating to controlled substances. Testimony, comments from Department of Health.
Good morning, Madam Chair. The Department of Health stands on its written testimony offering comments.
Thank you. Mr. Jared Radula, please tell me how to say your name.
Radula.
Mr. Radula from Department of Public Safety in opposition.
Yes, good morning, Chair, Vice Chair, and members of the committee. My name is Jared Radula. I am the State Narcotics Enforcement Administrator. I am also the state official that issues controlled substances registrations. Let me explain to the committee what a controlled substance registration is. It is a license to work with controlled substances in our state. Without it, healthcare practitioners will be severely hamstringed. They almost cannot stay in business without it. This measure, House Bill 378, focuses on methadone clinics, places where people have to get their medication for opioid use disorder every day, and substance use disorder services clinics. The term not defined and could mean many things, from simply talking to patients about their substance use problem to prescribing medications. Now, a clinic is a very popular business model in Hawaii. So the effects of House Bill 378 can be far-reaching. Let me talk to you about some of the impacts that could occur. There are only 2 clinics on Oahu, 2 methadone clinics on Oahu. One of them, if this passes, would be in peril and have to close within 1 year. That clinic services 275 patients, which means that they would have to go to the other program, and it's unclear whether or not the other program can bear that weight. If they cannot continue their treatment, they would be at risk for overdose and potential return to addiction. We also fear that this could have a chilling effect on any current treatment clinic or those that might come in the future. This bill provides no comfort. If a school were to be created in their vicinity, they too would be subject to this. There is a new federal law that was passed in December 2022, which endeavors to make drug treatment available to anyone who needs it. What the federal government did was, instead of keeping onerous credentialing requirements, they said any physician or nurse with the Controlled Substance Authority can engage in drug treatment with medications. A bill like this, if it passes and these practitioners are in a clinic setting, they might be barred from doing that. Let me kind of illustrate to you what the 750-foot barrier between a school and these clinics means. In downtown Honolulu, the biggest building is the First Hawaiian Tower. It's 430 feet tall. 750 feet equates to a 50-story building. We have a medical center here in downtown. Surrounding it are 3 schools, Royal Elementary, the Priory, and a preschool atop the city parking structure. If we take a 50-story building and start at one of those schools and lay it on its side, it most certainly would touch the medical center. If there are drug treatment services there, they either have to stop, move, or have to take their license away. We can consider other places like Kapiolani, where there are 3 schools next to it, Palimomi, where there's a school across the street, and in other places across the state where this could potentially impact. We're talking about potentially a lot of people who could be impacted here. Our department is not, we recognize that school safety and security is important. We are willing to work with the legislature and the schools to increase security and safety for students and to minimize any perceived harm with these clinics. But I respectfully come before you today and impassionately ask you to please defer this bill. Thank you.
Thank you, Mr. Radula. We're going to take a recess to allow the 10:15 a.m. agenda to be set up. Members, for this agenda, we will be reconvening shortly thereafter the 10:15. So we are in recess.
Good morning. We're back for decision making for our 9:05 agenda with the Economic Development Committee and the Committee on Health and Homelessness. We have one measure on our agenda, which is House Bill 1050 relating to the general excise tax exemptions. We're going to make technical amendments for clarity, consistency, and style, and defect the date to June 30th, 3000. That's it. Members, do we have any questions? Representative Kong.
Thank you, Chair. Earlier, I questioned the testifier about the tax systems in Hawaii, and knowing very well that Brian from DOTAX is here, and I could have gone through that process to explain what is what. But I just wanted to just point out, because even the testifiers, they don't understand the system. So here they are testifying in support and not understanding what they're testifying in support of. So I have just wanted to show that to the committee. In any case, I'll be voting no. Thank you, sir.
Thank you very much. Members, any further questions, comments? Representative Kobayashi.
I'm voting yes. I think that either by message or committee report, the term over-the-counter medicine should be more clearly defined.
Thank you very much. Any further questions, comments, members? If not, Vice Chair for the vote.
Members, we are now voting on HB 1050. Chair's recommendation is to pass with amendments. Chair and Vice Chair vote aye. Member Hasi Burdick, excuse. Member Kong?
No vote, please.
No vote for Member Kong. Member Nakamura? Aye. Member Quinlan? Excused. And Member Pierick? Excused. Chair, sorry. Recommendation is adopted.
Health and Homelessness Committee, same recommendation.
Health Committee, Health members overvoting on HB 1050. Chair's recommendation is passed with amendments. Chair and Vice Chair vote aye. Representative Amato?
Aye.
Representative Iligan?
Aye.
Representative Kobayashi?
Aye.
Representative Mizuno is excused. Representative Nishimoto is excused. Representative Garcia is excused. Chair, recommendation is adopted.
Thank you, members. We are adjourned on the 9:05 agenda. Reopening our 9:10 agenda on House Bill 662. Chair, this is for a joint committee meeting of the Committee on Health and Homelessness and ECD, Economic Development. Chair's recommendation is to move this bill out, adding dentist, changing the effective date to June 30th to 3000, and then any technical amendments identified by HMSO for consistency and clarity. Members, any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Voting on HB 662, Chair's recommendation is passed with amendments, noting the excused absences of Representatives Mizuno, Nishimoto, and Garcia. Any reservations or noes? Seeing none, Chair, recommendations adopted.
Chair, ECD?
ECD, same recommendation.
Members, we are now voting on HB 662. Recommendation of the Chair is passed with amendments, noting the excused absences of Member Hasi Burdick, Member Quinlan, and Member Pierick. Anyone voting no? Anyone voting with reservations? All members vote aye. Chair, your recommendation is adopted.
Members, we are adjourned. Thank you, Chair. Thank you, ECD. Reconvening our Health Committee, Health and Homelessness Committee at 10 a.m. Today's Friday, February 10th. Friday, February 10th. Resuming our testimony on House Bill 378, and I will just say I know that this might be hard for the people in person, but this is actually really wonderful to see everyone here in person because we can actually really ask questions and delve into the topics in front of us. We concluded with the testimony of Mr. Radula from Department of Public Safety on House Bill 378. Moving now to Department of Law Enforcement in opposition, Michael Vincent. Testimony in opposition, Alan Johnson.
Good morning, Chair and Vice Chair, members. I'm Alan Johnson with the Hawaii Substance Abuse Coalition. I just want to bring to your attention there's two big issues in the bill. The first one being substance abuse services. They don't store or dispense. They are involved with Suboxone, which family doctors prescribe, and patients get the prescription and they go to the pharmacy and fill it. So there's no lines. Schedule 3, same as barbiturates, same as hydrocodone with Tylenol, so substance abuse services. Now, with the new federal laws changing that all family doctors can prescribe that, and the state's intention to bring doctors and counseling services together, just about every doctor, we hope, in the next 5 to 7 years will have counseling services. Community health services will have this. Pain management clinics are already doing it. So having outpatient in there, I think, has unintended consequences that are far-reaching for our opioid strategies. For methadone, that is a Schedule 3 drug, and there are lines. There's only 2 agencies in the state, and I know that CHAMPS is in Chinatown near a school, and they're, what, 20-some years. They provide a need for the community for people to stay off of heroin and opioids. So what we suggest is that we should have some kind of dialogue. Before all those folks return to the streets, people got their jobs, the people on methadone got their jobs, got families. Before that happens, they go back to the street. We should have some kind of dialogue. There's been no complaint, no dialogue process, no meeting of the minds. We suggest maybe there should be an independent state agency or something, maybe try to lean over to see what are the problems all of a sudden and why are we going this route. And so we say there's been no dialogue. Let's start there. Thanks for today.
Thank you. In opposition, Hawaii Society of Addiction Medicine, Angela Goff. Testimony in opposition via Zoom, Hawaii Health and Harm Reduction Center, Mr. Likos Leverens.
Aloha, Chair, Vice Chair, and members. Nikos Leverens on behalf of the Hawaii Health and Harm Reduction Center. And I want to underscore the comments that were offered by Mr. Radula and Mr. Johnson. And we believe that this bill is a dangerously overbroad measure that would, compromise our state's ability to expand access to medical assisted treatment here on Oahu and on our neighbor islands, where in every jurisdiction, medication-assisted treatment is in far too short supply. And I did speak with the speaker a few Fridays ago and relayed our concerns as well. So mahalo for the opportunity to provide testimony on this.
Thank you. And Mr. Leverens, you also have testimony opposition from Drug Policy Forum of Hawaii.
Stand on that testimony.
Okay. We have testimony in opposition from Champ Clinic in person. Mr. Mohammed El-Dakhanki or anybody else from Champ Clinic?
Yes. Hello, my name is Leanne Simon. I had initially planned on coming in via Zoom, but I'm here in person. Instead, I'm representing both the Champ clients as well as the staff and the owner. In addition to my own statement, I have cards here that clients filled out. I did attach some of that in with my written testimony, just a sample. There are over 100 cards here, so 100 people have submitted in opposition as well as ours. So to begin, I would just like to say, give a little history. Champ has been in business for over 30 years. 28 of those have been in their current location. The problem in Chinatown with drugs and other social issues was there before Champ Clinic showed up. It will be there long after Champ is gone if this bill is to pass. And the consequences of that are severe. So as it is, CHAMP clients are required to submit to multiple random urine analysis drug screenings per month. They don't know when they're going to be. If they refuse these, or if they show any drugs in their system other than the methadone, and they do have to show the methadone and no other drugs before they're allowed to have any take-home doses. These doses are also monitored by the DEA. They're traceable by lot number. They would be able to see any instances of diversion into the community. We've never had a complaint via the DEA or the FDA, which we're also required to be licensed with. We also have never had any complaint with the school. This bill talks a lot about proximity, but nothing about safety. The assumption is safety anytime there's a mention of a school. This bill does not mention that in any way, and we are curious as to why that is. CHAMP very specifically, when we're talking about safety for the school, we employ a security guard that monitors the entire block there, and he has provided his own testimony to that as well. In addition to his being there to monitor our clients, make sure that our people are staying safe, he does keep an eye on the school on that side. We have a zero tolerance policy that none of our clients be on that side of the block, that none of our clients have any contact in any way with the students, unless of course they are their own children. In addition to our security guard, we have 24-hour independently monitored surveillance cameras that record all the activity on the front and sides of our building, and they also are able to capture any activity on the other side of the block. Those films are held off-site for a minimum of 90 days. We've never had any report back on any of those that need attendance. And again, we haven't had any official complaint from the school. In fact, we spoke with representatives of the school. They don't even know that we're there. We have testimony from several former students who have now graduated, who didn't know that CHAMP was there when they were attending school. Obviously, we haven't spoken to any of the children that are there currently, but I would wager a guess that they don't know that we're there either. There's no signage. We have rules around not loitering. Our people are not to loiter around the area. A lot of them do live in the area, and that's a lot of what we're seeing reflected here in the cards. The position of CHAMP and it being within 750 feet of a school, the location that CHAMP is in right now was very specifically chosen 28 years ago for its proximity to the bus lines. 95% of all the public bus routes for the entire island have stops within one city block of our front door. And that means people who are housed in different areas of the island can easily get here. But again, most of our folks live right around the area, and they will continue to live right around the area whether or not CHAMP is there. If CHAMP is to move, we have heard over and over and over again that people don't know what they'll do. There's a great fear that they will relapse, and you're talking about several hundred people simultaneously relapsing and potentially going back to old behaviors that could be quite dangerous for the neighborhood. Behaviors that are not only dangerous for themselves as far as overdose and harm to their bodies, but also harm to the community. Our clients rely heavily on other services that are centrally located right around us. So we're within walking distance of three major medical centers. So a lot of our folks go to dialysis or have other medical needs, cancer treatments, that they're able to go to the clinic to dose and then get on with their day. A lot of our people work nearby, work downtown. They have other, some of our folks, we acknowledge, do have legal issues, and they need to see their parole officers. They need to come here to the courthouse. They need to tap into these services, and they need to do that after they dose. Otherwise, they might not show up.
All right, thank you, ma'am. You know, we have a lot of testifiers on the agenda. I'd like you to wrap it up in like 15 seconds or less.
You got it. The main thing that we saw in the 1992 move is that there was a loss of about 50% of the clientele. It's the nature of addiction, and I did see this when I worked at H3RC as well, when I worked at the syringe exchange van, just moving a few blocks down the road, just a few parking spaces down the road, would mean our clients wouldn't see us, would just sort of give up. And again, that's the nature of addiction. It's easy enough to give up when things change. The continuity of care, the consistency is necessary for our people to do well, and for the community to do well, and for them to become positive, active members in that community.
All right, thank you.
Thank you.
Thank you. Members of the audience, there's a lot of testimony in support and in opposition of this measure. I'm going to let the next testifier go a little bit longer, but after this, I'm going to urge everyone, if you've submitted testimony, to stand on your written testimony, and then to just highlight very, very briefly, otherwise we are not going to be able to get through this agenda, and we have many other bills on this agenda, as well as 11 o'clock agendas and I believe 11:15 agendas. So that's just a caution, so please, if you can, just stand on your testimony. Is there a representative from the Department of Education or the Prince Ruth Ke'i'ileokolani Middle School who is testifying in support of this measure? Anyone here present for that, or the DOE, Hawaii Department of Education? All right, testimony in support from Brandon Galarita. Testimony in support from Rachel Galarita. Any testifier here in the audience in support of this measure would like to testify? Okay, I'm going to just open it up to anyone here in this audience wishing to testify at all? In support or opposition, it doesn't matter. Okay, I'm not going to call out the individual names, but if you want to come forward, state your name and your point, and if you've submitted, I ask you stand on your testimony, but go ahead.
Yes, thank you, esteemed members of the panel. My name is Paige Breet Nakamura, and I stand in opposition of this bill. I'm also a former client of Champ Clinic, and without that clinic, I would not be standing here today. I would have never gotten custody of my children back. I would have never learned how to drive a car. I would have never gotten off the street. I would not have the life that I have today. February 6th, I made 11 years clean and sober. And I give a lot of that credit to the fact that I had a methadone clinic in proximity to where I live, very easily accessible, so I would be able to be a success in my life. I was one of those people that was written off as never going to change. I was going to die in the gutter with a syringe in my arm. And I stand here today to tell you, please, consider the impacts of this bill against our community and the people that are trying to better their lives. Thank you.
Thank you. Any other testifiers? Come forward, please.
Hi, my name is Lane Lee. I'm a counselor at Champ Clinic. I stand in opposition of this bill. My son used to go to the middle school that's across the street back in 2017 and 18. Neither him or I knew that there was even a clinic across the street. I don't think it poses any kind of threat or danger. I think taking away the clinic would pose a threat and danger because you know, methadone it's insured by the insurance. You know, it's paid by the insurance, and if they don't have our clients don't have that there, they're going to go back to the familiar, which is opiate addiction, and so to fund that, they would have to turn back to crime, which would like obviously undoubtedly cause the crime rate to spike, and that would pose a real danger to the school. Thank you.
Thank you, Mr. Lee, and we did receive your testimony. Thank you. Any other testifiers would like to testify? Please come forward. Thank you for making the time to stop and come by to this committee hearing.
Hi everyone, my name is Nicholas Cuniff. I'm a counselor at Champ Clinic. Over the 2 years that I've worked at Champ, I've had the honor of being part of an organization that through its services is truly a pillar of hope in an area where many of Hawaii's homeless are filled with nothing but despair. Those in support of this bill would like you to believe that Champ is part of the problem here, when in reality we are the solution. Homelessness, drugs, and degeneration in the downtown and 4th Street Mall area were a problem before Champ, and they will continue to be even if we are forced to move. The clinic's founders chose its current location because it was at the heart of the issue, where it was needed most and could benefit the most, have the most benefit. Asking Champ Clinic to move would be like telling firefighters to put out a blaze from 2 blocks away from where the fire is actually taking place. Harm reduction is built on the foundation of meeting people where they're at, and at Champ Clinic, the phrase holds true both in the literal and figurative sense. Thanks.
Thank you, Mr. Clinic. Any other testifiers come forward? And then are there any testifiers in Zoom? We have one. Okay. If that person can get ready after this one.
Okay. Good afternoon. Oh, good morning, members of the committee. My name is Aisha Esker. I'm the manager at Champ Clinic. And I just wanted to confirm that on a regular basis, we do survey the community, including the school. And if there were any complaints or suggestions, it would come to me. And just to confirm, I have not received any formal complaints from any surrounding community members, any businesses, and definitely not from the school. Just a few days ago, I did call the school specifically in regards to this. I left a message for the vice principal, John Hamilton. Instead, I was able to get a hold of his assistant. His name is Joel. Joel was not even aware of our existence, but any complaints, if there were any complaints, it would have been done by him. And so he did confirm that the school does not have any complaints in regards to our business or our clients or anything like that. So I'm not going to review all of the points because I stand on my testimony. However, I do want to mention a few things from Mr. Aldecacne's testimony. So, you know, our business has been there for approximately 28 years. We haven't had any formal complaints in that time, so that's important. Number two, prior to moving to this location, we were renting. And in the rental process, we had to move 4 times in that very short period. And the reason is that landlords get pressured. And in order to alleviate that situation, he decided to purchase the building. So as owners of the building, we're able to stay there. Otherwise, we would have been pressured because this is a situation of not in my backyard. You know, we have luxury condos that have been built after we have already been there for so many years. And because of that, there's pressure to move because they want to improve their property values. This is not a situation of property values as far as we're concerned. We are more concerned with our clientele and the ability for our clientele to receive services. So in closing, I would like to say that this bill is against federal law, as methadone clinics are protected from discriminatory zoning under the ADA. I would like to remind the committee that every time this has gone to court in other states, and it has, New York, Pennsylvania, Florida, Texas, Maryland, the federal court sided with a methadone clinic against discriminatory zoning and prohibition of federally protected citizens from receiving treatment. People with opioid use disorder, OUD, have a disability, and they are protected from discrimination by the American Disability Act. They must be allowed to take their medication in a federally approved facility which is accessible to them. Passing this law would be in violation of the American Disability Act. We are protected and our clients are protected by the federal government. So I just wanted to make that clear, and I stand on my testimony in opposition of this bill. Thank you very much.
Thank you very much. Any other testifiers here in the room in support or in opposition? Testifier via Zoom, please identify yourself, turn on your camera, and go ahead. Okay.
Hello, my name is Thomas Milsarek, and from listening to the testimony, I oppose this bill. If something is working, if people are being helped, then why do we want to make it harder for them to be helped? As opposed to seeing this as a problem, we could actually bring school children here and hear the testimony of the woman who testified 10 minutes ago, how she was helped. That would be a wonderful lesson for our school children. So once again, I oppose this bill, and I oppose penalizing a program that is helping. Thank you.
Thank you, sir. Seeing no other testifiers, members, questions? All right, moving on to House Bill 88. Here
to testify.
Okay, go ahead. Please identify.
And I stand on my written testimony in strong opposition of the bill. I want to mahalo everybody that did just speak. They touched on every point that is very important. I believe that most of us, you know, we've said we've never had a report, and we don't know why our clinic is kind of being targeted in this situation. And although within the last couple of years, the opioid crisis increase has, the rapid increase has decreased, if that makes sense. It's not, it's still going up, and overdoses are still happening at an exceedingly high rate monthly. We, again, only have 2 clinics, and I think instead of there being oh, you know, not in my backyard type of thing, we all need to kind of get together, open a dialogue, as I heard, and see what we can do to help. But again, I stand on my written testimony. Thank you for allowing us to be here. And please, please, just, I also respectfully ask to dispose this bill. Thank you.
Thank you, ma'am. Can you just state what your name?
Jamie Paulo.
Okay, thank you. Seeing no other testifiers, members, we are going to move on to House Bill 882 relating to addiction recovery care. Comments, Department of Health.
Thank you, Madam Chair, Vice Chair. Department of Health stands on its written comments.
Thank you. Comments from Department of Human Services. Comments and testimony and support, Department of Public Safety, Tommy Johnson. Thank you. Tara, individual in opposition. Testimony and support, Dara Yatsushiro, individual. Any other testifiers in the room? Any other testifiers in the Zoom room? Seeing none, members, questions? Seeing none, moving on to House Bill 1337. This is relating to psilocybin. Comments from the Department of Health.
Good morning, Chair. The department stands on its testimony and comments.
Thank you. Beyond Mental Health, Dr. Thomas Cook in support.
Hi, good morning. I'm Dr. Cook. I'm a board-certified psychiatrist. In private practice, I have expertise in the addictivity of substances, depression, and in the prevention of suicide. I'm really here this morning for my patients because I attract a lot of patients who have failed, 5, 6, 7 or more antidepressants. Many of those pharmaceuticals increase the risk of suicide, as is known from the black box warning on Prozac. And we know that psilocybin reduces suicide risk from good data from Johns Hopkins University. It also has anti-addictive properties, but my main preoccupation today is with the reduction in suicide. And I cannot advise patients about psilocybin at all due to federal law and it being Schedule 1. Many medical providers believe it is the best antidepressant that exists, showing around 80 to 80% efficacy compared to around 40% for Lexapro, Prozac, and the like. And I had a suicide in my practice recently. It broke my heart. This is a nurse and someone who was just about to try it, as she reported to me a few weeks ago, and she was saying, I don't know what to do, I'm desperate. I've tried all these drugs, shock treatment, 8 different antidepressants. I'm at my wit's end, I don't know what to do. I have a friend who wants to get me psilocybin, I might try it. And then she missed an appointment and I found out she had taken her life. And my job is to prevent this from happening, and I cannot. And so due to federal law, I'm hamstrung. And that's really how psychiatry's been, obviously, for decades. But now we have a difference. We have data from Ivy League places, Johns Hopkins, Harvard, and whatnot. But the data is moving slowly and not fast enough. And that's why I'm here. I'm here really for my local Hawaii patients. And I believe this working group will allow a set number of professionals and DOH representatives to advise the legislature on the best way to proceed instead of waiting for federal change, which may take a long time. Thank you.
Thank you, Dr. Cook. Michelle Ha, Wellness Kuleana in support. Honolulu Psychotherapy, Kathy Southward in support.
Hello, I'm Kathy Southard from
That's my private practice, Honolulu Psychotherapy. Yesterday, I was also asked to take the lead for the Hawai'i Psychological Association for all psilocybin matters. So I just want to let you know the Hawai'i Psychological Association supports this measure as well. Thank you.
Okay, we will note that in the committee report that Hawai'i Psychological Association has submitted testimony in support as one of the groups. HUS Heroic Hearts Project in support. Joanne King Counseling in support. Drug Policy Forum of Hawaii in support via Zoom.
Aloha, Chair, Vice Chair, and members. Nikos Leverins with Drug Policy Forum of Hawaii, and we stand in strong support of this measure. As with cannabis, psilocybin is a Schedule I substance, and yet the FDA recently declared that psilocybin is a breakthrough therapy for severe depression. There was a body of research that was really developing quite well in the 50s and 60s, exploring the therapeutic potentialities of psilocybin, and that was slammed shut when it was placed as a Schedule I substance on the Controlled Substances Act. So we look forward to supporting ongoing efforts into the therapeutic potentialities of psilocybin, including for those suffering from severe depression and those with post-traumatic stress disorder. Mahalo for the opportunity to provide testimony.
Thank you. Testimony with comments, Hawaii Substance Abuse Coalition.
Please stand on our testimony.
Members, there is numerous individual testimony in support that we received, as well as testimony in support received late. Members of the audience, anyone here, rather than calling out in each individual name, anyone here to testify in support or in opposition to this measure? Please come forward, identify your name, and you can go ahead and speak.
Aloha, Chair, Vice Chair, members of the committee. My name is Blaine Williams. I'm an emergency physician here in Honolulu. I would like to testify in support of House Bill 1337. Psilocybin and psilocybin mushrooms are a medicine that can help people with depression, anxiety, addiction, end-of-life, existential distress related to having a terminal illness such as cancer. Also has shown promise with PTSD, as many veterans will testify. Also can help people with other conditions. It is a medicine, should never have been made illegal in the first place, and should be made available to the citizens of Hawaii to help combat mental illness and addiction. Please read my written testimony. I'm available for any additional questions. Thank you.
Thank you, Dr. Williams. Anyone else in the audience to testify in support or in opposition? We'll go with this individual and this one next. And then is there any testifiers in Zoom? Yes. Those two can start getting ready, and I'll call on you after we have the testifiers in the room. Go ahead.
Aloha kako. My name's Ashley Lukens, and I'm the founder and director of Clarity Project. I stand on my written testimony, which I think I emailed to the committee clerk a couple times. But I'm here to answer any questions about the national movement for regulated therapeutic access to psilocybin and what other states are moving forward with these programs. Certified integration therapists are going to be able to serve psilocybin to their patients in Oregon in May. So we have really great models to look towards, but this working group would help Hawaii ready itself for the implementation of these programs here.
Thank you, Ms. Lukens. Also wonderful to see you again in person. Next testifier.
Good morning.
Hello.
Aloha again. My name is Jadu Yeagle. I'm a psychologist. I'm licensed in California. I moved here about 1.5 years ago, and in the process of getting licensed here in Hawaii. And by the way, I apologize for the long-winded testimony, written testimony, but really what I want to say is that in a long history of working with plant medicine, from recreationally as a teenager to ceremonially with Peruvian shaman, to Grateful Dead concerts. Psychedelics have not only been healing and bonding with people I've been with, but also I think it's remarkable how much they actually open the heart. It can be very moving to see and to be seen, working through waves and levels of grief and trauma, and to reveal a human spirit over and over again. It's also remarkable that psychedelics, and psilocybin in particular, is so helpful and also not addictive. So I think once again, as has been testified already, it's just amazing that it would still be on Schedule 1. And yeah, I guess that's all that, working with clients, even those who haven't even tried psilocybin are kind of chomping at the bit because, yeah, we're just seeing both the research data coming out, the hopefulness about it, and then also the sort of limitations of the generic medical model and the materialistic worldview, right? So I think psychedelics have this immense potential to bring communities together, to heal addiction, because they change the brain, and that's really the biggest hack we have. I could go on and on because it's such a fascinating and incredible topic. Thank you for the time.
Thank you. One more testifier. Any other testifiers in the audience? Last question at the end. And then we have 2 testifiers via Zoom. Go ahead.
Aloha, my name is Duration. I'm a project manager of Clarity Project and testifying as an individual today in strong support. Just want to stand on my written testimony, highlight a few key pieces. One is that psilocybin is safe, natural, and non-addictive. It is also being studied along with other psychedelics by institutions, medical and academic institutions, including Yale, Imperial College, Mass General Hospital, and many, many others, all of which are listed in my testimony, who are creating psychedelic research and healing centers for patients, students, professors. And so it's really part of this national movement. Ashley highlighted what's happening in Oregon with the current rollout of their psilocybin program for therapists to offer that to patients. And we're also seeing Colorado having just in November voting to both decriminalize and create therapeutic access to psilocybin. So we just want Hawaii to be prepared, and we support the creation of this working group.
Okay, thank you. Testifier on Zoom. First one.
Amanda. Hi. Aloha, members of the committee. I'm testifying in strong support of this measure today. I run a family superfood mushroom business on Big Island with my brother, and I'm a huge advocate for the healing powers of mushrooms as medicine. Aside from the clinical evidence proving that psilocybin is effective for various mental health disorders, I personally have benefited greatly from having safe access to this medicine, have been able to heal from crippling childhood trauma that I had carried my entire life. And I just wish that everyone had safe access to this medicine. So please consider expanding access for our community so that the folks that need this the most can get the help that they deserve. Mahalo for your time.
Thank you. Second testifier in Zoom. Can identify yourself, state your name, and go ahead and testify.
Hi, I can testify. Aloha, Chair, Vice Chair, members of the committee. My name is Dr. Robin Martin. I'm a psychiatrist who trained and now practices in Honolulu. I'm also assistant clinical faculty at the Department of Psychiatry at UH, and I'm in strong support of HB 1337, which will establish the therapeutic psilocybin working group. In my profession, I'm on the front lines of addressing the mental health crisis, but you do not need to look far to appreciate the unmet need for new treatments. Depression is the leading cause of disability worldwide, and suicide is the second leading cause of death in the youth of Hawaii. And even if treatment is accessed, over 1/3 of depressed patients will not respond to current standard of care. Psilocybin-assisted therapy is one of the most promising new treatments for depression in a generation, and this bill is an important step forward in offering this treatment to those who need it the most. I'm happy to be available for any questions from the committee, and I appreciate the opportunity to testify.
Okay. Any other testifiers? Seeing none. Members, questions? Representative Amato.
So I have a question for the gentleman that is in the process of becoming licensed, I believe. Could you please explain what that process is? What does it look like to become licensed as someone to administer plant medicine?
I'm sorry, I meant licensed to, as
Please come,
psychologist.
wait, please come to the mic.
Sorry, I meant licensed in the state of Hawaii as a psychologist.
I see.
But yeah, as far as I know, there isn't a license to
No
administer
process.
psilocybin, although one can dream.
I see.
Yeah.
Well, I just
Okay.
want to thank you.
Answer some of that question because I just completed a certification at Naropa University affiliated with MAPS, the Multidisciplinary Association for Psychedelic Studies, where we are getting trained in the use of psychedelic medicines, including psilocybin, ketamine, and MDMA. So there is, everything's just being developed right now. So a lot of people don't know what exactly it's going to look like in the future. So we're just creating it. But there is going to be a lot of these certifications and you know, to make it available to the public, to reach the people most needed, we are going to need health insurance companies to help fund some of this work, and it is going to be cost effective. It's going to be more cost effective than sending people, you know, to our, you know, inpatient psychiatric units in and out their whole life, being on SSRIs their whole life. This medicine is transformative. It's only needed, like, you know, I mean, they're doing studies at, you know, Johns Hopkins right now. It's 4 times more effective than traditional SSRIs, and it's transformative. It's not, you don't have to be on it your whole life. So there are pathways coming. MAPS has a pathway, and you know, with Hawaii, we could start to look into some of these networks and organizations to really make sure the providers of this care are trained and certified. A lot of psychologists will be trained in these medicines. Actually, I'm a licensed clinical social worker who's been one for 20 years. Former Queens Medical Center psychiatry social worker. I used to work at a Harvard Medical School teaching hospital. A lot of my colleagues at Harvard are now the leads in this medicine. So we are getting trained. It's just all, it's, you know, it's a work in progress. So I just wanted to answer that question, that there should be a lot of pathways to be certified and vetted, that we are doing scientifically evidence-based work.
Okay, thank
Aloha.
you. Any further questions? Seeing none, for the rest of this agenda, members, I just want to note that we are going to be looking at an 11:15 agenda, so I really want to try to get through the rest of this expeditiously. A quick question for Department of Health on this measure. If this is put into a working group via concurrent resolution, there's no need for any additional funds, right?
That's correct.
Okay.
And the administrative burden would be significantly lighter.
Okay, thank you very much. All right, moving on, members, to the next topic, House Bill 1296 relating to early intervention services. We have testimony and support from Dr. Fink, Department of Health.
Good morning. Department of Health is testimony and support. We have representatives here to answer.
Thank you. Comments from Department of Human Services.
Good morning, Chair, Vice Chair, and committee members. This is Maureen Bates, the Administrator for the Division of Vocational Rehabilitation, and we stand on our testimony and support and are standing by for any questions. Thank you.
Okay, testimony and support, HMS DVR, Maureen Bates. Okay.
Good morning, Chair. This is Maureen Bates. I just stood on the testimony for the Department of Human Services. I apologize for the duplication. Thank you.
Okay, thank you. Any other testifiers in support or opposition in the room, in Zoom? Seeing none, members, questions? Okay. Seeing none, moving on to House Bill 322 related to Alzheimer's disease working group. Comments from Dr. Fink, Department of Health.
Aloha, Chair, members of the committee, Lauren Kim for the Department of Health. This definitely reflects a need in our community. However, the department prefers that House Bill 278 relating to health be the vehicle by which the legislature has this conversation on the need for a public health campaign. So we ask that this measure be deferred in favor of House Bill 278. Thank you.
Okay, thank you. Comments from Department of Health Executive Office on Aging.
Good morning, Chair, Vice Chair, members of the committee. We just asked that this public health campaign be incorporated into our state plan on Alzheimer's disease and related dementias, and that the work is included with our current work groups that we have. Thank you.
Thank you. Hawaii Primary Care Association testimony and support. Era Yatsuhiro, individual testimony and support. We have testimony from Barbara Service, individual and support. Any other testifiers in the room? Step forward, state your name and your organization.
Morning, Chair, Vice Chair. Ron Chimbubuku from the Alzheimer's Association. I want to thank you for hearing this measure and having the discussion on Alzheimer's disease, very important, as well as hearing House Bill 278. As previously mentioned, we stand on our written testimony, offering comments as there are working groups, as Director Kadirao had stated, as well as extending the time frame for appropriations for this measure. Thank you.
Thank you. Any other testifiers in the room? Any other testifiers in Zoom? Seeing none, members' questions. Seeing none, moving to House Bill 519. This is relating to dentists and dental hygienists. Testimony and support, Department of Health.
Department of Health stands on its testimony and support.
Thank you. Testimony and support, State Council on Developmental Disabilities. Ms. Bartoldes, Mr. Silver. Comments, University of Hawaii, Clementina D. Syria Ulep. Testimony and support, Hawaii Oral Health Coalition. Patrick Donnelly.
Hi, good morning. Good morning, Chair Bellotti and members of the committee. Patrick Donnelly, I'm the statewide Oral Health Coalition Manager for the Hawaii Public Health Institute. We're testifying in strong support of House Bill 519. I just want to highlight briefly that the American Dental Association's Commission on Dental Accreditation, or CODA, recognizes through a reciprocal agreement the dental programs that are accredited by the Commission on Dental Accreditation of Canada are equivalent to the standards that are held by CODA, and encourages states to support eligibility for licensure to the graduates of these accredited dental programs. So the language in this bill is intended to reflect the language that's presented in this longstanding agreement. Thank you very much for the opportunity to testify, and thank you for your consideration.
Thank you. David Peters, Ho'olahui, Hawaii. In support. Hawaii Children Action Network Speaks, Keopu Relets in support. Testimony in support, NYU Langone Hospital's Pediatric Dentistry Program, Dr. Lynn Fujimoto. Hawaii Dental Service in support, Dr. Diane Paloma. Stephen Pine, Hawaii Island Community Health Center in support. In support, Hawaii Dental Hygienists Association. Comments, Board of Dentistry. Oh. Thank you. Board of Dentistry, comments. Thank you. Hawaii Dental Association, comments.
Aloha, my name is Melissa Pavlicek. I'm here on behalf of the Hawaii Dental Association. We support the intent of this measure, and for clarity ask that you consider changing from merely CODA recognized to, as an earlier testifier mentioned, those colleges with reciprocal agreements with CODA. Thank you very much.
Thank you. We have testimony from a number of individuals in support, as well as having received testimony from a member of the Hawaii Oral Health Coalition, Annie Hivsdak, in support. Any testifiers in the room who would like to testify in support or opposition? Any testifiers in Zoom? Come forward. Please identify yourself, name, and your
My name is Dr. Don Sand. I'm a dentist who's been on the front lines of treating underserved in Hawaii for 8 years, and also in leadership for treating the underserved for 7 years. Aloha, Chair Bellotti and Vice Chair Taniguchi. As a founding member of HOHC, Hawaii Oral Healthcare Coalition, since 2019, and now the current chair on the Committee of Prevention and Access, I would strongly like to support HB 519. Hawaii does many things better than the 49 states, so we're lucky for living in Hawaii, but according to most public health metrics, our state has been receiving a failing score in oral health for many years. Even as our medical systems are highly respected across the states, our oral health care system has the highest disparity to access and inequality to dentist care as one compares to the access that higher and middle class individuals enjoy compared to our underserved, vulnerable, and homeless. Currently, oral health care in Hawaii is available only to those that afford it, and those who do not have excess funds or dental insurance struggle to even get their acute needs met. All ages are affected from keiki to kupuna, and the ones that are feeling it the most are the rural areas, many of our neighbor islands, and especially in the population of Native Hawaiian and Pacific Islanders. Today, thousands of people are missing their front teeth. They need to smile for work or job interviews, or to enjoy basic behavioral health needs, social needs, self-esteem needs. Today, every day, in all over across Hawaii, adults are suffering from the inability to enjoy just the basic plate lunch, much less have enough back teeth to get basic nutritional needs met through mastication. Finally, because the system is broken, every day our people are suffering in pain of oral infections and facial infections due to abscessed gums and teeth. And it not only is it costing our people, but it's costing our state. In a recent 5-year Hawaii study, oral disease that could have been prevented in the ER cost our state $38.7 million. And of that 38 million, or 39 million, half was taken from our Medicaid funds. Last year, this committee...
Sir, can you wrap up your testimony? We really need to get through this, otherwise we're going to run out of time.
Okay, I'll skip the problem. Here's the solution. This bill has no cost to the state. We'll save millions of dollars each year by allowing the state to license and deploy qualified dentists and hygienists with a temporary community health care license. One step, by licensing them, they can help with the underserved, the Medicaid, and the community service license. So again, this is in no way related to the unrestricted license. It's only to serve through that title called community service license. So thank you so much for supporting oral health care in Hawaii, and thank you for this time to testify. I can answer any questions if you have.
Thank you. We have one testifier via Zoom. Please come forward, and then Andrew Davidson, if you could come, be ready, prepared to testify on Zoom. Please come forward. I really want to urge you to be very brief because we are not going to be able to finish this.
I understand. And it will be brief compared to my written testimony that I'll submit. I am Joseph P. Merritt Jr., DDS, Hawaii Dental License DT 1980. I support this bill to expand community service dental licensed graduates of Canadian dental schools and expand facilities to non-federally qualified health centers, as there is a shortage of treatment facilities with necessary equipment to provide dental care. I would ask that the committee consider adding hospitals to the list of approved locations. This should help neighbor island hospitals. In my written testimony, I have an email from the coordinator of CODA Operations, Office of the Director for the ADA CODA, Marjorie G. Hooper, attached a statement to the effect that the Canadian dental schools are considered equivalent to U.S. dental schools by both the ADA and the U.S. Department of Education, which is the authority by which the ADA CODA is licensed to accredit U.S. dental schools. Additionally, the CODA position is that no further education is required for eligibility for licensing. The Hawaii Dental Board acknowledged the Canadian dental school graduates were permitted to apply for a Hawaii license as documented in Act 121, House Bill 568 of 2005, also in my submitted documents. I would ask that the committees consider striking out the language in Hawaii Revised Statutes 448 and 447 that state, no person who, after July 2004, has failed to pass the licensing examination administered under this chapter may be issued a community service license. End of statement. In my personal and professional opinion, not being licensed to work in the private sector and therefore the lack of higher compensation is sufficient consequences for not passing the examination. In my professional opinion, the current wording would be construed as intimidation and as a non-compete clause under the new FTC rulemaking process. Unless the previously approved community service dental provider had complaints filed with the dental board regarding patient treatment or conduct.
I'm sorry, you're going to have to wrap it up. You have it in written testimony. We will take it in written testimony, sir.
Okay.
Thank you.
Currently, the ADA clinical examination is not available to Canadian dental school students unless specifically authorized by a state board, in which case the ADEX examination is considered a state exam and not a regional exam. As such, scores are only reported to the authorized state board for licensing only in that state. Therefore, since the Hawaii State Dental Board approved Canadian dental graduates as noted in Act 121 of 2005, please consider adding language automatically granting Canadian dental students permission to take the ADEX exam. Thank you so much for your time and attention.
Thank you. Andrew Davidson in Zoom, please be very brief. You can provide that to the committee clerk, sir. Go ahead, Mr. Davidson or Andrew.
Hello, Chair and committee members. Thank you so much for the opportunity to testify in strong support of HB 519. Honestly, I appreciate everyone's time. I'll make it really quick. I'm a Canadian dentist. I work with underserved and Indigenous populations in Canada. This past year, I ended up being able to complete my Master of Public Health, and as such, I did research with Hawaii Oral Health Coalition. And to be honest with you, I was frankly a little concerned and shocked that Hawaii was experiencing the lack of access to care for Medicaid patients. Personal example, I wrote the IMBDE, I wrote the ADEX exams, which virtually makes me licensable in pretty much any other state because my dental school meets the accreditation standards that are recognized by the ADA's CODA, CDAC Mutual Reciprocal Agreement. Except for Hawaii. That's the only real estate that I've been able to experience that I wouldn't be able to obtain full licensure. As mentioned in the past, this is a real, no-cost approach to improve access to care. And really, in this way, we're able to protect the state's investment in ensuring the health and quality of life that everyone in Hawaii deserves, especially those receiving the recently reinstated Medicaid dental benefits. So I humbly ask you guys to support these proposed revisions to the Hawaii Dental Practice Act and pass HB 519. Thank you.
Thank you. Members, seeing no other testifiers, any questions? Seeing none, members, we're still waiting for our housing chair to come over, so we'll continue with this. My inclination for all of these bills and all of these measures is going to be to defer to decision making on Wednesday next week on our 11:30 a.m. agenda. We have received lots of testimony and we'll be considering all of the written testimony that has been submitted. Next up, House Bill 617. This is for Oral Health Task Force. I will note to all the committee, all the members in the audience, mostly in support. So if we can go through this quickly, that would be very helpful. Testimony first from the Department of Health. Thank you. Department of Human Services, comments. Comments from the University of Hawaii. Support Hawaii Oral Health Coalition. Support Hawaii Disability Rights Center. Support Hawaii Dental Service. Support Hawaii Children's Action Network Speaks. Support Papa'ola Lokahi. Testimony in support the Queen's Health System. Testimony in support Hawaii Island Community Health Center. Support Hawaii Dental Hygienists Association. Comments, Hawaii Dental Association. Aloha Care, support.
Chair Bellotti, may I say one word, please, on behalf of the Hawaii Dental Association? We do support this measure. However, we just ask that some language be stricken from the preamble that seems to point to an outcome, and to note that if the task force is going to look at increasing the number of dentists that serve Medicaid, that seems very laudable, but we would ask that more than 1 out of 20 members of the task force be dentists, please.
Thank you.
Thank you.
Thank you. Members, we have the Housing Committee here, so we are going to take a recess of our 10 a.m. agenda and resume it thereafter. Recess, opening up our, would you, Chair? Yes, we're gaveled in for housing.
All right, thank you, Chair, for gaveling in. Welcome, members. We're at our 11:15 Friday, February 10th hearing, Housing, Health and Homelessness Joint Hearing. First up, we have HB 671 relating to Ohana Zones. This appropriates funds for Ohana Zone pilot program, including expenses and operations, upkeep of facilities, provisions of services and administrative costs. First up, we have Department of Human Services. Department of Human Services in support, James Koshiba, Governor's Office. In support, Attorney General. On Zoom. Okay, they have some comments. Kelly E. Lopez, AARP. In support. And Ryan Nichols in opposition. AARP? You're here? Okay.
Good morning. I'm Audrey Suga Nakagawa, Advocacy Director for AARP. AARP is in strong support of this measure. You have my testimonies, and what I just want to point out to the committee members is that in AARP's statistical analysis of close to 1,000 older adults in Hawaii over age 55, for those over age 55, about 1,000 adults are expected to be evicted in 2023. And there's about more than 1,500 who are expected to experience homelessness in 2023. So we're very concerned that we need to look at all these different options to help prevent this homelessness. And this may be one of the really good solutions to address this issue. So we need to look at all the multi-pronged approaches in addressing this big crisis that we have that's facing our state. So thank you for testifying support.
Thank you, Audrey. We already called you, but I see James Koshiba. You want to come on up?
I'm sorry, I was in conversation outside. Aloha, James Koshiba, Governor's Coordinator of Homelessness. I'll stand on my written testimony in support, and I'm available for questions.
Thank you. We have a few others that have turned in testimony, so you can take a look at that in your packet. Anyone else wishing to testify in person or on Zoom? Come on up. Please introduce yourself.
Hi, good morning. Melissa Lewis, Deputy Attorney General. I'm just testifying on HB 671. It's just that under the Section 2, there's a general obligation bonds, and there's an authorization as well as an appropriation, but there's no expenditure. So if your intent is to expend it, then you would need to add that designated agency for expenditure, and I gave sample wording in my testimony.
Thank you.
Thank you.
Anyone else wishing to testify? Members, any questions? All right, seeing none, we'll move on to HB 1397 relating to supportive housing. We have HPHA.
Good morning, chairs, vice chairs, members of the committee. We stand on our testimony in support. Thank you.
Thank you. Department of Human Services.
Good morning, Chair Hashimoto, Chair Bellotti, and members. My name is Scott Morishige. I'm the Administrator for the Benefit, Employment, and Support Services Division on behalf of DHS and our Director, Kathy Betts. Department supports the intent and offers comments and respectfully requests an extension of the effective date of the measure. Thank you.
All right, thank you. We have Department of Public Safety. In support, James Koshiba, Governor's Office.
Aloha, James Koshiba, Governor's Coordinator of Homelessness. I'll stand on my written testimony and comments, and I'm available for questions.
Thank you. Catholic Charities of Hawaii, Betty Lou Larson.
Aloha, I'm Betty Lou Larson with Catholic Charities Hawaii. We feel that this is really a key bill for permanent supportive housing. It has all the pieces together, including the coordination that's so important to both work with construction, with rental subsidies, and with what's really needed is the ongoing supportive services to make this work. So we strongly support this bill. And even though the price tag seems pretty big, there would be great cost savings. Emergency rooms, hospitals, jails, many public services are being impacted by homelessness, as well as institutional care for the elderly or developmentally disabled, etc. So we urge your support for this bill. Thank you.
Thank you. HHFDC in support. Angie Knight, Institute for Human Services.
Good morning, and thank you for the opportunity to testify. Apologies for the late testimony. IHS stands in strong support of supportive housing. Daily, we see the benefits of supportive housing, and we just see this need continue to grow. We just also want to emphasize that as important as it is to have these services, it's important to have dedicated funding to make the services available. Thank you so much.
Thank you. There's a number of other testifiers that submitted testimony in writing, but anyone wishing to testify in person, come on up. Please introduce yourself.
Aloha, Chair Bellotti, Chair Hashimoto, and members of the committee. My name is Lisa Kimura. I'm a community benefit health manager with Kaiser Permanente, focusing on housing. Not only, of course, housing is health care, access to housing is a human right, but we have been investing a great amount of resources in grants, programs, and partnerships to be able to build an accessible pipeline for housing. One of the most important key points of it is coordinating care, and through some of the work we've done from the Mayor's Challenge and Built for Zero framework, has identified this as a major need, and this bill greatly addresses each of the components. Available for any kind of questions. Thank you so much.
Thank you. Anyone else wishing to testify? AARP, come on up.
I'm not sure if my testimony was not submitted, but I have a copy of it. But AARP stands in strong support of this measure, and we concur and echo all the comments that were provided by Betty Lou Larson of Catholic Charities. Kapuna are just as vulnerable and really could stay in their homes if they had the supportive services. So we stand in strong support. Thank you.
Thank you. Anyone else wishing to testify? Members, any questions? All right, seeing none, we are going to move into decision making. So HB 671, we are going to take the amendments as proposed by the Attorney General, which essentially will allow the governor to expend these funds, and they can assign it to the appropriate agency if they need to. I think this will be helpful because I think the governor's coordinator typically expends Ohana zones and they're in transition or probably moving somewhere else. So we will allow them that flexibility. And we're also clarifying Section 2 that the funds may be used for the purposes of constructing or rehabilitating facilities that will result in new units. And we want to emphasize it's new units for Ohana Zone's pilot program. I think it's very important because I think although we're giving Ohana Zones a big pot of funds, I think a lot of the funds are going to maintaining of current Ohana Zone programs. And I think our emphasis is we want to make sure that we're able to do new units so we can continue to house more homeless instead of just taking care of the ones that are currently in there. We'll defect the effective date to June 30th, 3000. Allow for technical and non-substantive revisions. And I think we wanted to add into this committee report that we should also look into mobile units. We have a bill that's coming up that discusses mobile units, but I think it's very appropriate for Ohana Zones to look into that as well. All right, any questions, comments, concerns, members? All right, Vice Chair for the vote.
Question?
Oh, question, Mr. Member Koyashi.
Is a expending agency directly stated?
Yes, if you take a look at the AG's comments, it's going to go to the governor's office.
Okay.
And then the governor's office can designate that agency. I think the homeless coordinators are moving under DHS at some point, but I don't know if that's actually happened yet. So we'll give them that flexibility. Any other questions, concerns, comments? All right, Vice Chair for the vote.
Members voting on HB 671, Chair elects to pass with amendments, noting the excused absence of Representative Onishi and Representative Todd. Are there any members voting no? Are there any members voting with reservation? Seeing none, Chair, your measure is adopted.
Thank you.
Oh, sorry. Health Committee, same recommendation for the vote, Vice Chair.
Health Committee voting on HB 671. Chair's recommendation is passed with amendments. Chair and Vice Chair vote aye. Representative Amato? Aye. Representative Iligan?
Aye.
Representative Kobayashi?
Aye.
Representative Mizuno?
Aye.
Representative Nishimoto?
Aye.
Representative Garcia?
Reservations.
Reservations for Rep. Garcia. Chair recommendations adopted.
Thank you. Moving on to HB 1397 relating to supportive housing. So we have a little bit of amendments for clarity. We're taking a look, and I think our staff, HMSO, kind of asked us to take a look and make some things a little bit more clear, which I think it's good for this bill. So we're going to amend Section 2, Part D on page 4. From line 12 up to the semicolon line 16 to read, the Hawaii Public Housing Authority shall implement project-based rent supplement payments of approximately $500 a month for units that are rented to eligible residents participating in the Supportive Housing Pilot Program. The project-based rent supplement payments are intended to assist project owners in maintaining rentals at levels affordable to eligible households with incomes at or below 30% of the area median income by providing owners with rent supplement payments, which together with rental payments received from eligible tenants will provide owners with limited but acceptable rates of return on their investments in rental housing accommodations. We're also going to add in on page 5, line 6, the phrase payments for, so it will read, the statewide office on homeless solutions shall administer payments for supportive services. We're going to blank out the amounts included in the bill in sections 3, 4, 5, 6, and 7, but add into the committee report that $50 million is needed for the rental housing revolving fund for supportive housing projects, $14 million for the purposes of project-based rent supplement program, $10.5 million for supportive services for qualified individuals and families in the supportive housing project, and $500,000 for a supportive housing information system. And we're going to allow for technical and non-substantive revisions. This bill is already defective. So, members, any questions, comments, concerns? Vice Chair for the vote.
Members voting on HB 1397, Chair elects to pass with amendments, noting that Representative Onishi and Representative Todd are so excused. Are there any members voting no with reservations? Seeing none, Chair, your measure is adopted.
Thank you.
Health Committee, same recommendation for the vote.
Health Committee voting on HB 1397, Chair's recommendations to pass with amendments, noting all members present. Any reservations or no's? Seeing none, Chair, recommendations adopted.
Chair, opening up our Health Housing 1120 meeting. We have House Bill 788. Everyone, my recommendation is going to be to defer this because we've rolled information about it into the committee report for the previously heard bill. But just going through and acknowledging, we received comments from the Governor's Office, comments from Department of Human Services, and you're welcome to testify if you want. Support, Hawaii Primary Care Association, Hawaii Health and Harm Reduction Center in support. In support, Cheryl B. In opposition, Tara Reed. Is there any testifiers on Zoom? Seeing none, any testifiers in the room? Seeing none, again, members, Chair's recommendation is to defer. Any comments, questions, or concerns? Seeing none, we're adjourned.
Thank you, Chair.
As you're leaving, we're going to be reopening up our 10 a.m. agenda. Members, we have in front of us House Bill 617 relating to oral health task force in support. In support, members, we have testimony from Department of Health. No, testimony in support. Do you have a question? No? 617. 617. Thank you. Department of Human Services. Hawaii Oral Health Coalition. University of Hawaii. Go ahead.
Thank you. I just want to clarify for Hawaii Oral Health Coalition and Hawaii Public Health Institute, we'll stand on our testimony in strong support. Thank you.
Hawaii Oral Health Coalition, I believe I said already. Lou Erdeshek, Hawaii Disability Rights Center. HDS. Papa'ololakahi, Queens Health System. Stephen Pine, Hawaii Island Community Health Center. ADHA, Aloha Care, Hawaii Dental Association. Nancy Partika, numerous individuals, Donald Sand, Andrew Siu. Do we have any other testifiers here in the room who'd like to testify? Go ahead, sir. I urge you to keep it to 1 minute or less.
I can keep it to 30 seconds. Thank you so much. This is Dr. Sand again. I just wanted to stand on support, strong support for HB 617. And I want to reiterate and highlight what the HDS advocacy person, Melissa Pavlik, said. There should be more than one dentist on the board, especially frontline dentists. The other two recommendations I'd have for language is anything this complex isn't going to happen with a 2-year plan, so I'd like to request that the task force go from 2 years to 3 to 5 years. And then the third point I'd like to recommend is there should be 1 or 2 national experts, because Hawaii should try to use best practices from other states and other renowned experts. Thank you so much, Doc. This is Don Sam.
Thank you. Any other testifiers in the room, in Zoom? Seeing none, members, any questions? Seeing none, House Bill 885, this is related to ACT again, members, and we have a number of bills that we're going to be looking at later on. We have testimony in support, Hawaii Department of Health. Stacy from Department of Health, stand on our testimony. Hawaii Disability Rights Center, testimony in support. Mariah Graham's testimony in support. Dara Yatsushiro, testimony in support. Any other testifiers? We have late testimony from Raylan Reno Yeoman's comments. Any testifiers in the room? Any testifiers in Zoom? Seeing none. Members, House Bill, questions or concerns? House Bill 884, members, this is related to traveling team physicians. We have testimony in support with comments from the Hawaii Medical Board. All right, thank you. Testimony and support, University of Hawaii. Comments from Esther Brown. Thank you. Testimony from American Medical Society for Sports Medicine. All right, any other testifiers in the room? Okay, any other testifiers in the room? Any testifiers in Zoom? Seeing none, members, any comments, questions, or concerns for any of the testifiers? Seeing none, members, so all of the measures on this 10 a.m. agenda, we are going to move to the hearing agenda for Wednesday, 11:30 a.m. We're going to adjourn this and then reopen our 8:30 a.m. agenda. Members, we are adjourned.
8:30.
Is Nishimoto here? Everything is deferred until 11:30. Do we have to come back? You don't have to come back. Okay, we can watch it on the a.m. agenda and explain what's happening on our agenda. First up, on House Bill 897, we are going to take House Draft 1, adopting the amendments of Department of Human Services, as well as deleting the provision recommended by the Attorney General's Office, any technical amendments offered by HMSO, and a defective date of June 30th, 3000. Members, any questions? Go ahead, please be quick.
Thanks, Representative Garcia. I wanted to thank the chair of the Health Committee for moving this piece of legislation along with the vice chair who's of Human Services, who's the introducer. Not many people know about FASD, and so I wanted to thank, again, the chair of Health and the vice chair of Human Services, and Darlene, who's been a great, probably the top supporter in the state. Thank you very much, Chair. Appreciate you doing this.
Thank you, and I think this is a really important measure, so we will work with the stakeholders as well as with the Department of Human Services and the SSD division, where we've identified where the appropriate measures have to be taken. Members, seeing no other comments, questions, or concerns, Vice Chair for the vote.
Health Committee voting on HB 897. Chair's recommendation is passed with amendments. Chair and Vice Chair vote aye. Representative Amato?
Aye.
Representative Iligan?
Aye.
Representative Kobayashi?
Aye.
Representative Mizuno?
Aye.
Representative Nishimoto?
Aye.
Representative Garcia?
Aye.
Chair, recommendations adopted.
Chair's recommendation for House Bill 900 is to defer. I've talked with the Sorry, Human Services needs to vote as well. Go ahead.
Defer also.
No, same recommendation.
Oh, I'm sorry. I'm losing it. Yeah, same recommendation as the chair of health. Madam Vice Chair, can you take the vote?
Voting on HB 897, Chair's recommendation passed with amendments. Let's see. Chair and Vice Chair both voting aye. Representative Belatti.
Aye.
Representative Iligan.
Aye.
Representative Kobayashi.
Aye.
Representative Takanuchi.
Aye.
Representative Nishimoto.
Aye.
And Representative Garcia.
Aye.
Chair, your measure is adopted.
Members, House Bill 900, Chair's recommendation is to defer. After speaking with the introducer of this bill, we're going to work on trying to establish a special fund with other measures moving in a future legislative session. Chair's recommendation, House Bill 1308, is to defer on the fingerprinting. As we've learned more about the options available, we'll work through the administration to see if we can continue to streamline the process and make it simpler. Members, on House Bill 1309 relating to care homes, Chair's recommendation is to do an HD1, blank out the date, excuse me. Adopt the recommendations of Department of Human Services, blank out any appropriation dates, add a the effective date of June 30th, 3000, and again, any technical amendments identified by HMSO. Members, any comments, questions, or concerns? Seeing none. Vice Chair.
Health Committee voting on HB 1309. Chair's recommendations passed with amendments, noting all members present. Any reservations or noes? Seeing none, Chair, recommendations adopted.
Human Services.
Same recommendation.
Voting on HB 1309, Chair's recommendation is passed with amendments. Chair and Vice Chair vote both voting aye. Any members voting no or with reservations? Seeing none, Chair, measure is adopted.
And members, I want to just apologize. The comments I made on House Bill 897 were supposed to be for House Bill 1309, and I believe that's the same thing for the comments that the Human Services Chair made as well, or might have made on House Bill 897. It should have been for 1309. Members, Chair's recommendation on the next two bills, as having heard of the opposition from the various departments and the fact that we are moving House Bill 1309, which is, I think, a better vehicle to address some of the needs of this care home community. Chair's recommendation for House Bill 488 and 1488 and 1491 is to defer. Members, any comments, questions, or concerns? Seeing none, members, we are adjourned. Okay. Sorry, members, opening up House Bill 278 at 11:30 a.m. relating to health. This is another Alzheimer's bill. We've heard another Alzheimer's bill that we're going to be hearing, having decision-making at 11:30 a.m. on next week, Wednesday. So we're moving this bill, House Bill 278, to 11:30 a.m. next week, Wednesday, for decision-making. Members, any comments, questions, or concerns? No. Seeing none, we are adjourned.